The slap echoed through the surgical corridor loud enough to stop conversations 3 rooms away. Nurse Emma Cortez didn't stumble. She absorbed the blow, felt the sting bloom across her cheek, and watched the stainless steel instrument tray clatter across the tile floor. Blood pooled warm against her lower lip. Chief Surgeon Marcus Hyland stood over her, his face twisted with contempt, his hand still raised. "Military trash," he hissed, loud enough for everyone to hear. "You don't belong anywhere near real medicine." Emma touched her mouth, saw red on her fingertips, and met his eyes without blinking. Then every alarm in Mercy Ridge Medical Center started screaming at once. But before I show you what happened next, I need you to do something. Stay with me until the end of this story. Like this video. Drop a comment telling me what city you're watching from. I want to see how far this story can travel. Now let me take you back to where it all started. 6 hours earlier, Emma Cortez had walked through the employee entrance of Mercy Ridge Medical Center in Phoenix wearing scrubs that had seen better days and carrying a travel mug of gas station coffee. The badge clipped to her collar identified her as a trauma nurse, Level 2 certification, hired 3 weeks ago to fill gaps in the emergency department's brutal overnight rotation. Nobody looked at her twice. She preferred it that way. The emergency department at Mercy Ridge operated with the controlled chaos of a machine constantly on the edge of breaking down. Nurses moved fast, doctors moved faster, and everyone knew the hierarchy. Surgeons at the top, residents scrambling in the middle, nurses holding everything together at the bottom. Emma clocked in, checked the patient board, and started her rounds. The first patient was a construction worker with a compound fracture. The second was a college kid who'd wrapped his car around a light pole. The third was an elderly woman having chest pain. Emma moved between them efficiently, checking vitals, updating charts, asking the right questions. She was good at her job, precise, calm under pressure. The kind of nurse who caught mistakes before they became disasters. That was exactly what got her in trouble. Dr. Marcus Hyland swept into the trauma bay around 10 in the morning, trailed by 2 residents who looked like they hadn't slept in 48 hours. Hyland was tall, silver-haired, and expensive. Everything about him screamed prestige. His suit probably cost more than Emma made in a month. His watch definitely did. He was also Mercy Ridge's golden boy, the surgeon who brought in wealthy patients and good press. The man hospital administrators protected no matter what. Emma had heard the stories. Everyone had. Hyland was brilliant in the operating room and brutal everywhere else. He screamed at nurses, belittled residents, and threw instruments when things didn't go his way. But he brought in millions in revenue, so the complaints disappeared into HR black holes and nothing ever changed. She'd avoided him for 3 weeks. That streak ended when he walked up to the elderly woman with chest pain and started barking orders. "Get me an EKG. I want a full cardiac workup. And somebody page cardiology before this woman codes on us." One of the residents fumbled with the chart. "Dr. Hyland, the initial assessment shows..." "I don't care what the assessment shows. I'm looking at a textbook MI. Move." Emma glanced at the monitors. Heart rate steady. Blood pressure elevated but stable. No ST elevation on the rhythm strip. She'd already run the preliminary tests. This wasn't a heart attack. The woman had acid reflux and anxiety. She should have kept her mouth shut. "Dr. Hyland," her voice was quiet but clear. "The presentation doesn't match MI. Troponin levels are normal. EKG shows no acute changes. I think we're looking at GERD, possibly exacerbated by stress." The room went silent. Hyland turned slowly, his expression shifting from surprise to something darker. "Excuse me?" "The symptoms point to gastroesophageal reflux, not cardiac." "I know what GERD is, nurse." He squinted at her badge. "Cortez, what I don't know is why you think your opinion matters when I'm making a diagnosis." Emma kept her voice level. "I'm not questioning your diagnosis, doctor. I'm offering information from the preliminary workup. Information I didn't ask for. Information that could prevent unnecessary cardiac intervention." The residents exchanged nervous glances. One of them took a small step backward. Hyland moved closer, invading her space. "Let me make something very clear. I don't need nursing staff playing doctor. I especially don't need some..." He paused, looking her up and down. "Military washout trying to second-guess me in my own ER." Emma felt something cold settle in her chest. "I was offering clinical observation based on what? A few years stitching up soldiers in field hospitals? That's not medicine. That's battlefield triage. This is a real hospital, and you are a real nurse, which means you follow orders instead of giving them." The elderly patient was watching now, eyes wide with confusion and fear. Emma forced herself to stay calm. With respect, Dr. Hyland, the evidence suggests... Get out. She blinked. Sir? Get out of this bay. Get out of my sight. And if I ever hear you contradict me in front of patients again, you'll be getting out of this hospital permanently. He turned away dismissively, already moving on to the next order. Emma stood there for 3 seconds that felt like 3 hours. Every instinct screamed at her to push back, to defend herself, to make him listen. But she'd learned a long time ago that some battles couldn't be won by fighting harder. She left the bay. Behind her, she heard Hyland ordering the full cardiac workup anyway. Wasting time, wasting resources, terrifying an old woman who just needed antacids and reassurance. Emma walked to the break room, poured herself water she didn't drink, and stared at the wall. Her hands weren't shaking. They never did. An hour later, the elderly woman was discharged with a GERD diagnosis and a prescription for omeprazole. Exactly what Emma had suggested. Nobody apologized. Nobody acknowledged it. That was how the system worked. Emma finished her shift in relative quiet, handling 3 more patients without incident. She documented everything carefully, kept her head down, and counted the hours until she could leave. She almost made it. At 4:47 p.m., she was restocking supply cabinets in the surgical prep corridor when she heard raised voices coming from operating room 6. The surgery was supposed to be routine, appendectomy on a 16-year-old boy. Quick in, quick out. Something had gone wrong. Emma moved closer to the observation window. Inside, Hyland was operating while 2 nurses and a resident scrambled to keep up. The patient's vitals were crashing, blood pressure dropping, heart rate climbing. The resident looked panicked. "Doctor, he's bleeding somewhere. I can't find the source." Hyland's hands moved fast, too fast, searching. Suction, more suction. Somebody get me visualization. Emma's eyes tracked the monitors, the blood pooling in the surgical field, the way the patient's abdomen was distending. She saw it immediately. Hyland had nicked the mesenteric artery during the initial incision. Small tear, easy to miss in the moment, but now it was bleeding into the abdominal cavity faster than they could suction. If they didn't clamp it in the next 90 seconds, the kid was going to bleed out on the table. She should have walked away. She didn't. Emma pushed through the OR doors, already moving toward the scrub sink. "What the hell are you doing?" Hyland shouted without looking up. "Mesenteric artery," Emma said, scrubbing fast. "Superior branch, 3 centimeters from the initial incision line. You need to pack the upper quadrant and clamp proximal to the bleed." "Get her out of here!" One of the nurses moved toward Emma, but Emma was already pulling on gloves, already stepping up to the table. "Pack it now, or he dies." Something in her voice made them hesitate. Maybe it was the absolute certainty. Maybe it was the complete absence of fear. Either way, nobody moved to stop her. The resident grabbed packing material with shaking hands. Emma's eyes stayed locked on the surgical field, tracking anatomy the way some people tracked constellations. "Proximal clamp," she said quietly, 2 centimeters above the tear. "You'll feel resistance when you hit the artery wall." Hyland's jaw clenched, but his hands moved. The clamp closed. The bleeding slowed, then stopped. The patient's vitals began to stabilize. The OR went quiet, except for the steady beep of monitors and the hiss of the ventilator. Hyland pulled back from the table, his gloves covered in blood, his face white with rage. "Out!" His voice was shaking. "Get out! Now!" Emma stepped back, stripped off her gloves, and left without a word. She made it halfway down the corridor before security caught up with her. "Miss Cortez?" The guard looked uncomfortable. "I need you to come with me." They escorted her to a windowless office on the 3rd floor. Hospital administrator. Mid-50s, expensive suit, expression that gave away nothing. "Sit down, please." Emma sat. The administrator, his nameplate read Gerald Risch, folded his hands on the desk. "Dr. Hyland has filed a formal complaint. He's alleging that you entered a sterile operating room without authorization, interfered with an active surgery, and violated multiple hospital protocols. I prevented a fatality." "That's not what his report says." "Then his report is wrong." Risch leaned back. "Dr. Hyland is one of our most respected surgeons. His reputation is beyond question. His patient was bleeding out, and he had it under control." Emma stared at him. "No, he didn't." "Your employment here is probationary, Miss Cortez. You've been with us for less than a month. Dr. Hyland has been with Mercy Ridge for 12 years. Who do you think the hospital is going to believe?" The answer was obvious. Emma stood. "Are you firing me?" "I'm suspending you pending investigation. 2 weeks, unpaid. If Dr. Hyland decides to pursue this further, termination is a real possibility. And the patient is stable and recovering. Because I stopped the bleeding. Rish's expression hardened. Because Dr. Hyland is an excellent surgeon who handled a complication with skill and professionalism. Your version of events is noted. Now please surrender your badge and leave the premises. Emma unclipped her ID, set it on the desk, and walked out. She made it to her car before the anger hit. Not hot, explosive rage. Cold, focused fury that settled in her bones and stayed there. She'd saved that kid's life, and they were punishing her for it. She sat in the parking lot for 20 minutes, hands on the steering wheel, breathing slowly. Then her phone buzzed. Unknown number. She almost didn't answer. This is Cortez. Captain Cortez? The voice was male, clipped, professional. This is Lieutenant Colonel Hayes, Army Medical Command. I apologize for the short notice, but we have a situation developing in Phoenix. I need you to return to Mercy Ridge Medical Center immediately. Emma's pulse quickened. Sir, I've been suspended. I'm not currently authorized to... Your suspension is irrelevant. This is a military emergency. A convoy was ambushed 40 minutes ago on the outskirts of the city. We have a critically wounded flag officer en route to Mercy Ridge right now. He needs trauma surgery, and you're the only person within 50 miles with the clearance and experience to handle it. What about the hospital's trauma team? They're not cleared for this. You are. We're activating your reserve status effective immediately. Full authorization under federal medical emergency protocols. You have 15 minutes to get back to that hospital. The line went dead. Emma stared at her phone, her mind racing. Then she started the engine and drove. She arrived at Mercy Ridge 12 minutes later. The parking lot was chaos. Military vehicles everywhere. Armed soldiers establishing a perimeter. News helicopters circling overhead. Emma badged through. Her ID still worked in the system despite the suspension, and headed straight for the trauma bay. The corridor was packed with military personnel. Officers, enlisted, MPs, all of them moving with the sharp efficiency of people who knew exactly what was at stake. Emma pushed through, looking for whoever was in charge. She found him near the elevator bay. Lieutenant Colonel Hayes, tall, African-American, wearing combat fatigues with enough ribbons on his chest to tell a story. Captain Cortez. He didn't salute. Too much chaos, but his nod carried the weight of one. Our patient is 3 minutes out. Brigadier General William Carver, 52 years old. Multiple gunshot wounds to the chest and abdomen. He's already coded twice. The civilian paramedics have him stabilized, barely, but he needs surgery immediately, or he's not going to make it. What's his status? Hemorrhagic shock. Penetrating trauma to the right lung, possible cardiac involvement, suspected liver laceration. The medics did what they could, but this is beyond field medicine. Emma's mind shifted into the mode she hadn't used in 2 years. Combat trauma. Time-critical intervention. No room for hesitation. I need an OR prepped, O-negative blood standing by, and a surgical team that can follow orders without asking questions. Hayes nodded. Already done. OR3 is yours. And the hospital staff? We've informed administration. They're cooperating. Emma started moving toward the surgical wing. Hayes fell in beside her. Captain, there's something else you should know. General Carver isn't just any flag officer. He's the commanding officer of JSOC's Medical Oversight Division. If we lose him, it's not just a tragedy. It's a national security incident. Understood. They rounded the corner into the surgical prep area and ran straight into Marcus Hyland. He was standing in the middle of the corridor, flanked by 2 of his residents, blocking the path to OR3. His face was flushed with anger. What the hell is going on here? I have surgery scheduled. You can't just commandeer my operating rooms. Hayes stepped forward, his voice flat and hard. This is a federal medical emergency. We have full authorization under Title 10 U.S. Code. Your surgeries are postponed. Like hell they are. I don't care what kind of authorization you think you have. This is my hospital, my surgical wing, and I'm not letting some... He spotted Emma and his eyes went wide. You're suspended. What are you even doing here? Emma met his gaze without expression. Working? Not in my hospital, you're not. Security. Hayes moved between them, his presence suddenly taking up a lot more space. Dr. Hyland, the surgeon operating on General Carver will be Captain Emma Cortez, United States Army Reserve Medical Corps. She has federal authority that supersedes hospital administration. If you interfere with this operation, you will be detained. Am I clear? Hyland's face went purple. This is insane. She's a nurse, a suspended nurse. She has no business performing surgery on anyone, let alone some general. Captain Cortez, Hayes said quietly, is a board-certified trauma surgeon with 6 years of combat experience, 3 tours overseas, and more field trauma experience than everyone in this hospital combined. She holds the rank of captain in the Army Medical Corps and has clearance that you will never see. Now step aside. The corridor went dead silent. Highland stared at Emma like he'd never seen her before. Emma stared back. "Nurse?" she said softly. "I was never just a nurse, Dr. Highland. I'm a surgeon. I've been a surgeon for 8 years. I took a nursing position here because I was evaluating Mercy Ridge for a potential military partnership program. You just didn't bother to ask." Highland's mouth opened. Nothing came out. Somewhere down the hallway, elevator doors chimed. Hayes's radio crackled. "Patient incoming. 60 seconds." Emma turned away from Highland like he'd already stopped existing. "Let's go." She scrubbed in fast, muscle memory taking over. The OR was prepped exactly how she'd requested. Surgical team standing by. Blood ready. Instruments laid out. The doors burst open and they wheeled General Carver in. He looked bad. Gray skin, shallow breathing, blood-soaked bandages covering his chest and abdomen. Emma moved to the table, her hands already working. "Get him under. Start the transfusion. I need exposure from the xiphoid process to the pubic symphysis." The team moved. No questions. No hesitation. Emma's scalpel traced the midline incision with absolute precision. Behind her, through the observation window, she could see military personnel gathering. Hospital staff, administrators. Marcus Highland standing at the back, watching. Emma didn't care. She had a patient to save. The surgery was brutal. Damage worse than the initial assessment suggested. 2 bullets had fragmented on impact, sending shrapnel through multiple organs. The right lung was shredded. The liver had a through-and-through that was bleeding into the peritoneal cavity. And there was cardiac involvement, a graze across the pericardium that had caused a small tamponade. Any one of those injuries could kill. Together, they should have already. Emma worked with the kind of focused intensity that came from operating in field hospitals under mortar fire. No wasted movement, no hesitation, just surgery stripped down to its essential core. Find the damage, stop the bleeding, keep the patient alive. Clamp. Suction. 2 units of ONEG. Push it. The team around her moved like they'd been doing this for years instead of minutes. Good people. Skilled hands. They just needed someone who knew how to lead. 40 minutes in, Emma repaired the liver laceration and started on the lung. 60 minutes in, she addressed the cardiac issue and stabilized the pericardium. 90 minutes in, General Carver's vitals were climbing back toward normal. 2 hours in, Emma closed. She stepped back from the table, her scrubs soaked with sweat and blood, and looked at the monitors. Stable heartbeat. Blood pressure normalizing. Oxygen saturation climbing. He was going to make it. The OR erupted in quiet relief. Not cheering, too professional for that, but Emma could feel the tension break like a snapped wire. Hayes stepped into the room, still in his combat fatigues, and met Emma's eyes. "Good work, Captain." Emma pulled off her gloves. "He's not out of the woods yet. Next 48 hours are critical. But if he makes it through tonight, his chances are good. Better than good, thanks to you." Emma shook her head. "Thank your medics. They kept him alive long enough to get here." She left the OR and headed straight for the scrub room. Her hands were steady as she washed blood from her forearms, watching red water spiral down the drain. Behind her, the door opened. She didn't turn around. "That was extraordinary." Hayes's voice. "I've seen a lot of combat surgeons, Captain. You're one of the best." "I did my job." "You did more than that. You saved a man's life under conditions that would have broken most surgeons." Emma dried her hands carefully. "What happens now?" "Now we wait. General Carver goes to ICU under military guard. You maintain oversight as the primary surgeon, and—" He paused. Emma finally turned to look at him. Hayes's expression was grim. "And we have a conversation about what happened earlier today." "Sir? I pulled your file when we activated you, saw the suspension notice, read the complaint filed by Dr. Highland." Hayes's jaw tightened. "I also pulled security footage from the hospital, all of it." Emma went very still. "Everything?" she asked quietly. "Everything." They stared at each other. Hayes pulled out his phone and turned the screen toward her. Emma saw herself standing in the surgical corridor, saw Marcus Highland approaching, saw him yelling, gesturing, his face twisted with rage. Then she saw the slap. The image froze on her face, blood at the corner of her mouth, Hyland's hand still raised. That's assault, Hayes said flatly. Assault on a federal medical officer during activation. It's not just a hospital HR issue anymore, Captain. It's a criminal matter. Emma stared at the screen. She'd known he was going to pay eventually. She just hadn't expected it to happen this fast. Somewhere in the building, alarms started going off again. Not emergency alarms this time, just the normal chaos of a hospital that never slept. But Emma heard something else underneath the noise. Footsteps. Moving fast. Multiple people. Hayes's radio crackled. Sir, federal investigators are on site. They're asking for Dr. Hyland. Hayes looked at Emma. It's your call, Captain. You want to press charges? We move forward. You want to let it go? We can make this disappear. Emma thought about the elderly woman terrified by an unnecessary cardiac workup, the 16-year-old kid who almost bled out, 3 weeks of whispered complaints and ignored warnings. She thought about every nurse who'd been screamed at, every resident who'd been humiliated, every patient who'd suffered because one man had too much power and too little oversight. Press charges, she said. Hayes nodded and lifted his radio. Send them in. The investigators arrived in plain clothes but carried themselves like military. 2 men, 1 woman, all of them moving with the kind of precision that came from years of federal work. They found Marcus Hyland in the surgeon's lounge, drinking coffee and trying to look calm while his hand shook hard enough to rattle the cup against the saucer. He saw them coming through the glass door and stood up fast enough to knock his chair backward. Can I help you? The lead investigator, tall, black, early 40s, pulled out credentials. Special Agent Devin Morris, Department of Defense Criminal Investigation Division. This is Agent Reeves and Agent Park. We need to speak with you about an incident that occurred earlier today. Hyland's face went pale. I don't know what you're talking about. Then let me refresh your memory. Morris pulled out a tablet and turned it toward Hyland. The screen showed security footage from the surgical corridor. Timestamp, 4:52 p.m. Hyland's hand connecting with Emma's face in perfect high definition. The color drained completely from Hyland's face. That was a misunderstanding. She was interfering with hospital operations. What I see, Morris interrupted, is you committing assault and battery against a federally activated medical officer during a military emergency. That's not a misunderstanding, Dr. Hyland. That's a felony. She was suspended. She had no right to be in that surgical wing. Agent Park, Asian American woman, compact and unsmiling, stepped forward. Captain Cortez's suspension was rescinded the moment she was activated under federal medical emergency protocols, which means when you struck her, she was operating under military authority. You didn't just assault a hospital employee, Doctor. You assaulted a United States Army officer. Hyland's mouth worked, but nothing came out. Morris continued in the same flat tone. We're also investigating allegations of witness intimidation, falsification of medical records, and obstruction of federal operations. The assault is just where we're starting. This is insane. I'm the chief of surgery at this hospital. Do you have any idea who I am? We know exactly who you are. Agent Reeves finally spoke. White guy, mid-30s, looked like he could bench press a truck. We've been reviewing your file for the past 2 hours. 47 complaints filed against you in the last 5 years. 18 formal investigations, all of them closed without action. 6 nurses transferred to other departments after working with you. 2 residents left the program entirely, and that's just what made it into official records. Hyland's jaw clenched. Those complaints were baseless. Hospital administration reviewed every single one and found no evidence of wrongdoing. Morris smiled without warmth. Hospital administration isn't in charge anymore. We are, and we're very good at finding evidence that other people miss. He gestured toward the door. You can come with us voluntarily for questioning, or we can do this the hard way. Your choice. Hyland looked around the lounge like he was searching for an exit that didn't exist. 3 other doctors were pretending not to watch while clearly listening to every word. I want my lawyer. Smart, Morris nodded. You're going to need one. They escorted him out through the main corridor. Emma watched from the ICU observation deck as Hyland walked past, flanked by federal agents, trying to maintain some dignity while staff members stopped to stare. Lieutenant Colonel Hayes stood beside her. How are you holding up, Captain? I'm fine. That's not what I asked. Emma turned to look at him. Hayes had the kind of face that had seen too much and somehow kept going anyway. Lines around his eyes, gray threading through his hair, the weight of command sitting on his shoulders like old armor. Honestly, sir? I don't know yet. Ask me tomorrow. Hayes nodded. Fair enough. For what it's worth, you did the right thing, both in that OR and with the charges. Doesn't always feel like it. Never does. Hayes checked his watch. General Carver's stable. You should get some rest. I should monitor him through the night. You should sleep. We have a full medical team standing by. They'll call you if anything changes. Emma hesitated. Every instinct told her to stay, to keep eyes on her patient, to make sure nothing went wrong. Hayes saw it. That's an order, Captain. Go home, shower, sleep. Come back in 8 hours with a clear head. She wanted to argue. Instead, she nodded and left. The parking lot was quieter now. Most of the military vehicles had pulled out, leaving just a few MPS maintaining security around the emergency entrance. News vans still lined the perimeter, cameras pointed at the building, reporters doing stand-ups for the evening broadcast. Emma kept her head down and walked to her car. She made it halfway across the lot before someone called her name. Captain Cortez? Emma turned. A young nurse, maybe 25, dark hair pulled back in a ponytail, was jogging toward her. Emma recognized her from the ER. Sarah something, one of the newer hires. I just wanted to say... The nurse stopped, breathing hard. What you did today? In the OR with that appendectomy patient. I was one of the nurses assisting Dr. Hyland. You saved that kid's life. Everyone knows it, even if nobody's saying it out loud. Emma didn't know what to say to that. Sarah continued, her words coming faster now. And the thing in the corridor, when he hit you, I saw it happen. So did 4 other people. We've been talking, and if you need witnesses, if you need statements, we'll give them. All of us. We're done being scared of him. Something tight in Emma's chest loosened slightly. Thank you. No, thank you. Sarah glanced back toward the hospital. He's been getting away with this for years. Somebody needed to stop him. She turned and jogged back toward the building before Emma could respond. Emma sat in her car for a long time, hands on the steering wheel, watching the hospital through the windshield. Then she drove home. Her apartment was small and mostly empty. She'd only been in Phoenix for a month. Most of her stuff was still in storage. The furniture was minimal: bed, couch, table, chair. Walls bare except for a single framed photograph of her Army unit from her last deployment. She dropped her keys on the counter, stripped off her clothes, and stood under the shower until the water ran cold. When she finally crawled into bed, sleep came hard and fast. She woke 6 hours later to her phone buzzing. Unknown number again. Cortez. Captain, this is Agent Morris. Sorry to wake you, but we need to talk. Emma sat up, instantly alert. Is General Carver all right? General's fine. This is about Dr. Hyland. We've been conducting interviews with hospital staff, and some interesting information has come to light. Can you come down to the Federal Building? When? Now would be good. Emma was dressed and out the door in 10 minutes. The Federal Building was downtown, all concrete and tinted glass and security checkpoints. Morris met her in the lobby and escorted her through to an interview room on the 4th floor. Agent Park was already there, surrounded by file folders and a laptop showing what looked like spreadsheets. Thanks for coming in, Captain. Morris gestured to a chair. We wanted to update you on where the investigation stands. Emma sat. I'm listening. Park turned the laptop so Emma could see the screen. Over the past 8 hours, we've interviewed 23 current and former Mercy Ridge employees, nurses, residents, administrators, support staff. What we're finding is a pattern of behavior going back almost a decade. She clicked through files. Each one showed complaint forms, incident reports, internal memos. All of them about Marcus Hyland: sexual harassment, verbal abuse, physical intimidation, falsification of medical records to cover mistakes, retaliation against staff who reported problems. And that's just the surface level. Morris leaned against the table. The deeper we dig, the worse it gets. We found evidence that hospital administration actively suppressed complaints to protect Hyland's reputation. He brought in too much money, so they buried the problems. Emma scanned the documents, names she recognized, incidents she'd heard whispered about. How bad? Bad enough that criminal charges are almost certain. Federal assault charges for what he did to you, potentially state charges for the other incidents. Park's expression hardened. We're also looking at the hospital itself. If administration knowingly covered up this behavior, they're liable too. What do you need from me? Your testimony. Official statement on record about the assault and everything leading up to it. We'll also need you to testify if this goes to trial. Emma nodded. Whatever you need. They spent the next 2 hours going through everything. The initial confrontation over the GERD patient, the appendectomy surgery, the suspension, the assault itself. Every detail documented, recorded, locked into the official record. When they finished, Morris walked her back to the lobby. One more thing, Captain. This is going to get messy. Hospital's already lawyering up. Highland's family has money and connections. They're going to come at you hard. Let them. Morris studied her face. You're not worried? I'm a combat surgeon who operated in field hospitals under mortar fire. Hospital lawyers don't scare me. He smiled slightly. I believe you, but watch your back anyway. People with power don't like losing it. Emma drove back to Mercy Ridge. It was early afternoon now. The news vans had multiplied, reporters everywhere, cameras tracking anyone who entered or left the building. She badged in through the employee entrance and headed straight for ICU. General Carver was awake. He looked rough, pale, drawn, hooked up to a dozen different monitors, but his eyes were clear and alert. Lieutenant Colonel Hayes stood next to the bed, along with another officer Emma didn't recognize, two-star general based on the insignia. Hayes saw Emma and gestured her forward. Captain Cortez, this is Major General Patricia Vance, MedCom Deputy Commander. Vance looked Emma up and down with the kind of assessment that came from 30 years in uniform. Captain, Colonel Hayes tells me you're the reason General Carver is still alive. I did what any trauma surgeon would do, ma'am. Bullshit. Carver's voice was rough but strong. I've been briefed on my injuries. What you did in that OR was exceptional. He paused, coughed, grimaced. Thank you. Emma nodded. How are you feeling, sir? Like I got shot multiple times and had major surgery, but alive, so I can't complain. He shifted slightly in the bed. I also heard about what happened with that civilian surgeon, the assault. Yes, sir. And you're pressing charges. Yes, sir. Carver looked at Vance, then back at Emma. Good. Nobody puts hands on one of our people, especially not some civilian who doesn't know his ass from his elbow. Vance spoke up. Captain, we're reassigning you effective immediately. General Carver will be transferred to Walter Reed for continued care, and you'll be going with him as the primary surgical consultant. After that, she paused. We'd like to talk to you about a permanent position with MedCom. Emma blinked. Ma'am? You were evaluating Mercy Ridge for a potential military partnership program. That program is now dead in the water, obviously, but your performance over the past 24 hours has drawn attention at very high levels. We have positions available that would make better use of your skills than working night shifts at civilian hospitals. I appreciate that, ma'am, but I need to see this investigation through first. Vance nodded. Understood. Take whatever time you need. The offer stands. Emma spent the next hour checking Carver's vitals, reviewing his labs, making sure everything was progressing as expected. The general tolerated it with good humor, even when she made him rate his pain level for the third time. When she finally stepped out of the ICU, she found Sarah waiting in the hallway. The young nurse looked nervous. Captain Cortez, can I talk to you for a minute? Of course. Sarah glanced around to make sure they were alone. Those federal investigators came by earlier. They interviewed me about Dr. Hyland. I told them everything. The way he screams at nurses. The time he threw a surgical tray at a resident. The patient complications that got covered up. How did it feel? Terrifying, but also... Sarah's voice got stronger. Also like I was finally doing something instead of just keeping my head down and hoping things would get better. Emma understood that feeling completely. There's something else. Sarah pulled out her phone and pulled up a group chat. This is the Mercy Ridge Nurses Network, private group, about 60 people. They're all talking about what happened, about you, about finally speaking up. She scrolled through messages. Emma saw dozens of stories, small incidents and major ones. A pattern of abuse so consistent it was almost mundane. We want to know what we should do, Sarah said. The investigators said they're interviewing people, but should we be documenting this ourselves? Should we go to the media? Should we talk to the investigators? Emma interrupted gently. Tell them everything. Keep your own records, yes, but let the professionals handle the legal side. And don't go to the media unless you're prepared for your life to become very public very fast. Sarah nodded slowly. What are you going to do? My job. Take care of patients. Testify when they need me to. Let the system work. And if the system doesn't work? Emma met her eyes. Then we make it work. Sarah left looking slightly less nervous. Emma headed back toward the surgical wing to check on her other patients from the previous day. She made it halfway there before she ran into Gerald Risch. The hospital administrator looked like he'd aged 5 years overnight. His suit was rumpled. His eyes were bloodshot. He saw Emma and stopped dead. Miss Cortez, Captain Cortez, I need to speak with you. I'm listening. Rish glanced around the busy hallway. Not here. My office. Emma followed him to the third floor, the same windowless room where he'd suspended her less than 24 hours ago. Rish closed the door and turned to face her. I want to apologize. Emma waited. I was wrong. About the suspension. About not listening to your side of the story. About... He trailed off. About a lot of things. Okay. The hospital board met this morning. Emergency session. We're cooperating fully with the federal investigation. Dr. Hyland has been placed on indefinite administrative leave pending the outcome of the criminal case. And we're implementing new policies for reporting workplace misconduct. That's good. Rish looked uncomfortable. We'd also like to discuss your employment status. Obviously, the suspension is lifted. We'd like you to return to your position, with a significant raise and a formal apology in your personnel file. Emma studied him. You want me to come back so it looks like you're doing the right thing. I want you to come back because you're an excellent medical professional who deserves better treatment than you received. And because having a decorated Army surgeon on staff would be good PR during a federal investigation. Rish's jaw tightened. Both things can be true. Emma thought about it. She thought about Sarah and the other nurses who were finally finding their voices, about the patients who needed competent care, about the system that protected people like Hyland until someone forced it to change. I'll think about it, she said. That's all I can ask. Rish pulled out a business card and wrote something on the back. My direct line, call any time. Emma left his office and walked back toward ICU. Her phone buzzed. Text from an unknown number. This is Agent Morris. Press conference scheduled for 6 p.m. at Federal Building. Formal charges being announced. Thought you should know. Emma checked her watch. 3 hours. She spent them working, checking on patients, reviewing charts, doing the quiet, unglamorous work that actually kept people alive. At 5:45, she left the hospital and drove downtown. The Federal Building's press room was packed, reporters everywhere, cameras set up in the back. Emma slipped in through a side door and stood against the wall where nobody would notice her. Agent Morris took the podium at exactly 6 o'clock. Good evening. I'm Special Agent Devin Morris with the Department of Defense Criminal Investigation Division. I'm here to announce charges filed today against Dr. Marcus Hyland, Chief of Surgery at Mercy Ridge Medical Center. The room erupted with questions. Morris ignored them and continued. Dr. Hyland has been charged with assault and battery of a federal officer, obstruction of military operations, and witness intimidation. Additional charges may be filed pending the outcome of our ongoing investigation. Dr. Hyland is currently in federal custody and will appear before a magistrate tomorrow morning. More questions. Shouted over each other. Chaos? Morris held up a hand. We're also investigating the hospital's administration for potential violations related to the concealment of workplace misconduct. That investigation is ongoing. No further questions at this time. He stepped away from the podium while reporters shouted after him. Emma slipped out before anyone could spot her. She was halfway to her car when her phone rang. Hayes. Captain, turn on the news, Channel 7. Emma pulled up the live stream on her phone. A reporter stood outside Mercy Ridge doing a live broadcast. Behind her, the hospital's main entrance. The chyron at the bottom read, Breaking, celebrated surgeon charged with assault of Army officer. The reporter was mid-sentence. Sources confirm that the officer in question is Captain Emma Cortez, an Army Reserve trauma surgeon who was working at Mercy Ridge undercover as part of a military evaluation program. Hospital staff say Dr. Hyland had repeatedly clashed with Captain Cortez before the alleged assault, which was captured on security footage. Emma's stomach dropped. Her name. On the news. Being broadcast to hundreds of thousands of people. Her phone started buzzing. Text messages, emails, calls from numbers she didn't recognize. She turned off her phone and drove home in silence. When she got to her apartment, there were 3 news vans parked on the street outside. Emma kept driving. She ended up at a 24-hour diner on the edge of the city, sitting in a back booth with coffee she didn't drink and food she didn't eat. Her phone stayed off. She sat there for 2 hours, watching traffic pass on the highway outside, thinking about everything that had happened in the last 36 hours. Finally, she turned her phone back on. 47 missed calls, over 100 text messages, voicemails from reporters, lawyers, people she'd served with in the Army, nurses from Mercy Ridge, and one message from a number that made her blood run cold. Captain Cortez, this is Attorney Michael Reardon representing Dr. Marcus Hyland. We need to discuss your false accusations against my client and the significant legal consequences you're facing. Call me immediately." Emma stared at the message for a long time. Then she deleted it and called Agent Morris instead. He answered on the first ring. "Captain, I saw the news. You okay?" "Define okay." "Fair point. Look, I'm sorry your name got out. We tried to keep it sealed, but these things leak. It's going to be rough for a while." "I can handle rough." "I know you can, but be prepared. Highland's lawyers are going to come at you hard. They're already spinning this as a misunderstanding blown out of proportion by overzealous federal agents. They're going to try to make you look like the aggressor." "Let them try." Morris was quiet for a moment. "There's something else you should know. We've uncovered financial irregularities at Mercy Ridge. Looks like hospital administration was paying off former employees to keep quiet about Highland's behavior. Hush money agreements, NDAs, the works." "How many people?" "At least 12 that we've found so far. Probably more. This goes deeper than we initially thought." Emma closed her eyes. "How bad is this going to get?" "Honestly, I don't know. But I've been doing this job for 15 years, and I've never seen a case with this many layers. Every rock we turn over has something ugly underneath." "What do I do?" "Same thing you've been doing. Tell the truth. Don't talk to Highland's lawyers without legal representation, and don't let them intimidate you into backing down." "I won't." "I believe you. Get some rest, Captain. Tomorrow's going to be a long day." Emma ended the call and sat in the diner booth watching the highway through the window. Her phone buzzed again. This time it was Sarah. "Captain Cortez, I don't know if you've seen the news, but please be careful. People are saying things online. Bad things. Some of the doctors who are friends with Highland are defending him. They're saying you set him up, that you wanted attention, that you're lying." Emma's hands tightened around her phone. Another message came through. "But the nurses know the truth. We're with you. All of us." Emma typed back, "Thank you. Stay safe." She paid for her coffee and left the diner. The streets were quieter now, late enough that most people were home. She drove around for a while, no particular destination, just moving. Eventually, she ended up back at Mercy Ridge. The parking lot was mostly empty except for staff vehicles and a few news vans keeping vigil. Emma parked in the back corner and sat there with the engine off. Through the hospital windows, she could see the lights in ICU. General Carver was up there, recovering. So were a dozen other patients whose lives depended on people doing their jobs correctly. That was what this was really about. Not revenge, not vindication, just making sure the people who needed help got it from professionals who gave a damn. Emma got out of her car and walked toward the employee entrance. She badged in and took the stairs up to ICU. General Carver was asleep but stable. The monitors showed strong vitals, good signs. Emma checked his chart, made some notes, adjusted one of his IV medications. A nurse she didn't recognize was stationed at the ICU desk. Young guy, early 20s, looked nervous. "Can I help you?" he asked. "I'm Captain Cortez, General Carver's primary surgeon." His eyes went wide. "Oh, I've heard about you, about what happened." "I'm sure you have." "For what it's worth," he said quietly, "a lot of us are glad someone finally stood up to Highland. He was a nightmare to work with." Emma nodded, but didn't say anything. She finished her notes and headed back toward the elevator. The surgical wing was quiet. Most of the ORs were dark. One was prepped for an emergency case, instruments gleaming under surgical lights. Emma stood in the doorway looking at the empty operating table. This was where she belonged. Not in administrative offices or federal interview rooms or news broadcasts. Here, in the OR, saving lives. Everything else was just noise. She was about to leave when she heard voices down the hallway. Angry, getting closer. Emma stepped back into the shadows near the supply closet. Two men rounded the corner. One was a doctor she recognized from the ER. The other was someone in an expensive suit, lawyer. "Complete disaster," the doctor was saying. "Half the nursing staff is ready to walk. Morale is in the toilet. And now we've got federal investigators crawling through our files looking for God knows what." The lawyer's voice was calm, professional. "The hospital has done nothing wrong. Dr. Highland's actions, if proven, are his responsibility alone. The institution is cooperating fully with all investigations." "Cooperating? We're hemorrhaging staff and patients. The board is panicking, and that army surgeon is all over the news making us look like we run a slaughterhouse." "Captain Cortez is the least of your problems right now. She's the one who started this whole mess." No. The lawyer stopped walking. Dr. Highland started this mess when he assaulted a federal officer. Captain Cortez is just the person who finally called him on it. They moved past Emma's hiding spot and disappeared around another corner. Emma waited until their footsteps faded, then headed for the exit. She made it to the parking lot before her phone rang again. Lieutenant Colonel Hayes. Captain, where are you? Just leaving the hospital. Why? Good. Don't come back tonight. We've received credible threats against you. Nothing specific, but enough that we're taking precautions. Military police are being assigned to provide security until this situation calms down. Emma's blood went cold. What kind of threats? The usual internet tough guy garbage. But given the high profile of this case, we're not taking chances. Where are you staying? My apartment. Not anymore. We're moving you to secure housing on base until further notice. Pack a bag. Detail will pick you up in 30 minutes. The call ended. Emma stood in the parking lot, keys in hand, trying to process what was happening. 24 hours ago, she'd been a suspended nurse facing termination. Now she was the center of a federal investigation with military police protection and death threats from strangers on the internet. She got in her car and drove home. The news vans were gone from her street, but she spotted an unmarked sedan parked 2 buildings down. Military police probably already in position. Emma went upstairs, threw clothes and essentials into a duffel bag, and was back in the parking lot in 15 minutes. A black SUV pulled up. 2 MPs in civilian clothes got out. Captain Cortez, we're here to escort you to base housing. Emma threw her bag in the back and climbed in. They drove in silence through Phoenix streets that suddenly felt hostile. Every car a potential threat. Every shadow hiding something dangerous. The base was 40 minutes outside the city. Secure perimeter. Military police at the gates. Housing units that looked like cheap apartments but felt like bunkers. They set her up in a 2-bedroom unit with reinforced doors and panic buttons in every room. Someone will be posted outside 24/7, one of the MPs explained. You need anything? Just ask. And don't go anywhere without letting us know first. Understood. They left her alone. Emma sat on the couch in the empty apartment and stared at the wall. Her phone buzzed. Text from Agent Morris. Preliminary hearing tomorrow at 9 a.m. Highland's lawyers are going to push for dismissal. We need you there. Emma texted back. I'll be there. She tried to sleep but couldn't. Instead, she lay in bed staring at the ceiling, listening to the sound of the MP walking patrol outside her door, thinking about everything that had led her to this moment. Somewhere across the city, Marcus Highland was in a holding cell facing charges that could end his career and put him in prison. Somewhere in Mercy Ridge, nurses were whispering about finally being heard. Somewhere in ICU, General Carver was healing because Emma had refused to back down when it mattered most. And somewhere in the darkness, people who didn't even know her were making threats because she dared to challenge someone powerful. Emma closed her eyes and waited for morning. When dawn finally came, she showered, dressed in a clean uniform, and mentally prepared herself for whatever came next. The MPs drove her to the federal courthouse downtown. It was surrounded by protesters, some supporting Highland, some supporting her. News crews everywhere. Emma kept her head down and walked straight through the crowd. Inside, Agent Morris was waiting. Ready? As I'll ever be. They entered the courtroom just as the judge was taking the bench. Marcus Highland sat at the defense table, surrounded by 5 lawyers in expensive suits. He looked smaller somehow, diminished. When his eyes met Emma's across the courtroom, she saw something she'd never seen before. Fear. The judge banged his gavel. Be seated. We're here for the preliminary hearing in United States versus Marcus Highland. Is the government ready to proceed? The prosecutor stood. Yes, Your Honor. Defense? Highland's lead attorney rose. Ready, Your Honor. And we'd like to begin by moving for immediate dismissal of all charges based on... The courtroom door burst open. Every head turned. A woman stood in the doorway. Mid-30s, dark hair, wearing scrubs with a Mercy Ridge ID badge still clipped to her collar. Emma recognized her. Dr. Jennifer Walsh, one of the residents who'd worked under Highland. Walsh walked straight to the prosecutor's table. Her hands were shaking, but her voice was clear. I have evidence, she said. About Dr. Highland, evidence that changes everything. The judge leaned forward. Who are you? Dr. Jennifer Walsh steadied herself against the prosecutor's table. Her scrubs were wrinkled like she'd slept in them. Dark circles under her eyes. She looked like she'd been awake for 72 hours straight. Dr. Jennifer Walsh. I'm a surgical resident at Mercy Ridge. I've been working under Dr. Hyland for 3 years. Hyland's lead attorney shot to his feet. Your Honor, this is highly irregular. The witness list was established. I wasn't on the witness list because I didn't know I was going to testify until 2 hours ago. Walsh pulled a flash drive from her pocket. But I have recordings, video and audio, 3 years worth. Everything Dr. Hyland did, everything he made us cover up. The courtroom erupted. The judge banged his gavel hard. Order. Counselor, approach the bench. Both of you. The prosecutor and Hyland's attorney moved forward, heated whispers. The judge examining the flash drive with a tight expression. Emma watched Walsh. The resident was trembling but holding her ground. Hyland stared at her with naked fury that made Emma's skin crawl. The lawyers returned to their tables. The judge spoke carefully. Miss Walsh, you're claiming this evidence is directly relevant to the charges against Dr. Hyland? It proves a pattern. Assault, intimidation, medical malpractice covered up by threats. It shows he's done this before, multiple times, to multiple people. Your Honor, this is ambush testimony, Hyland's attorney protested. We haven't had time to review any alleged evidence because you would have destroyed it. Walsh's voice cracked. Just like you destroyed evidence before. Just like you paid off witnesses. Just like you made people disappear who tried to speak up. The judge held up a hand. Miss Walsh, these are serious allegations. Are you prepared to testify under oath? Yes. Do you understand that making false statements in federal court carries severe penalties? I understand. Everything I'm saying is true. The judge looked at the prosecutor. Your position? The government requests an immediate recess to review this evidence. If it's substantive, we'll need to amend our charging documents. Hyland's attorney jumped in. Your Honor, the defense objects strenuously. This is clearly a coordinated effort to prejudice the court. Save it. The judge's voice went cold. We're in recess for 2 hours. Both sides will review the evidence. Miss Walsh, you'll remain available for questioning. Court resumes at 11:30. The gavel came down. Emma followed Agent Morris and Walsh into a conference room down the hall. Park and Reeves were already setting up a laptop. Walsh handed over the flash drive with shaking hands. How long have you been recording? Morris asked. Since 6 months into my residency. After the first time Walsh stopped. Started again. After he assaulted me in an empty OR and told me if I reported it, he'd make sure I never practiced medicine anywhere. Emma felt ice in her stomach. He assaulted you. Grabbed me by the throat and slammed me against a wall. Left bruises I had to cover with makeup for 2 weeks. Walsh's voice was flat now, matter of fact. That's when I started documenting everything. I bought a pen camera, wore it every shift, recorded every interaction. Park plugged in the flash drive. Hundreds of video files appeared on screen, date-stamped, organized by incident type. Morris clicked the first one. The video showed an operating room, Hyland standing over a patient, Walsh visible at the edge of frame. The audio was crystal clear. You're worthless, Hyland's voice. A complete waste of a residency slot. I've seen medical students with better hands. Doctor, the patient's pressure is dropping. Shut up and suction. If you can manage that without screwing it up. The video showed him throwing a surgical instrument. It hit Walsh in the shoulder. She flinched but kept working. Morris paused the playback. How many files like this do you have? Over 300. Verbal abuse, thrown instruments, threats, and worse. Walsh pulled up a folder labeled Patient Complications. These are the ones where he made mistakes and blamed other people, or where he ordered us to falsify records. She clicked a file. Different OR. Different patient. Hyland performing what looked like a routine cholecystectomy. The audio captured him cutting too deep. The patient started bleeding. Damn it, clamp now. A resident's voice, uncertain. Doctor, that's the hepatic artery. I know what it is. Clamp it. But sir, if we clamp the hepatic artery without proper... Do what I tell you or get out of my OR. The video showed them clamping the artery. The bleeding stopped. But Emma knew what that meant for the patient. Liver ischemia. Potential necrosis. Long-term complications. Walsh's voice was hollow. The patient died 4 days later. Liver failure. Dr. Hyland blamed post-operative infection and altered the surgical notes to hide what really happened. Agent Park looked up from the laptop. You have documentation of the altered records? Walsh pulled out a folder stuffed with papers. Before and after versions. I photographed everything before it went into the system. Then I photographed it again after he changed it. Morris took the folder carefully. Miss Walsh, why didn't you come forward before? Because I was scared. Because he threatened to destroy my career. Because I saw what happened to other people who tried to report him. Her voice shook. But when I heard what he did to Captain Cortez, when I saw the news about federal charges, I realized this was my chance. Maybe the only chance to stop him before he hurt someone else. Emma spoke quietly. You did the right thing. Walsh laughed bitterly. Did I? My career is over either way. If Hyland walks, he'll make sure I never work in medicine again. If he goes down, I'm the resident who recorded her attending without consent. Either way, I'm done. You saved lives by coming forward, Emma said. That matters more than any career. Park was still scrolling through files. Her expression got progressively darker. We need to get this to the prosecutor immediately, she said. And we need to expand this investigation. If even half of this is accurate, we're looking at multiple felonies, patient endangerment, insurance fraud, obstruction of justice. Morris was already on his phone. Get me the U.S. attorney, now. The next hour was chaos. Federal prosecutors reviewing evidence, defense attorneys trying to get access, Walsh giving statement after statement while court reporters documented everything. Emma sat in the corner watching it all unfold. Lieutenant Colonel Hayes appeared in the doorway. Captain, word's spreading. Hospital staff are coming forward. We've had 6 calls in the last 30 minutes from nurses and residents who say they have information about Hyland. How bad? Bad enough that the hospital board just announced Hyland's termination, effective immediately. They're trying to distance themselves before this gets worse. Emma checked her phone. News alerts were already appearing. Breaking, Mercy. Ridge fires chief surgeon amid federal investigation. Video evidence surfaces in assault case. The story was going national. Hayes sat down next to her. How are you holding up? Ask me when this is over. That could be months, years, if this goes to trial. Emma met his eyes. Then ask me in years. At 11:30, they reconvened in the courtroom. The gallery was packed now. Press, hospital staff, people Emma had never seen before. The judge entered, and everyone stood. Be seated. He looked exhausted. The court has reviewed preliminary evidence submitted by Dr. Walsh. Based on what I've seen, I'm denying the motion to dismiss. The government may proceed with its case. Hyland's attorney stood. Your Honor, the defense requests bail pending trial. Dr. Hyland has deep ties to the community, no criminal record, and poses no flight risk. The court disagrees. The judge's voice was hard. Given the nature of the charges and the additional evidence suggesting a pattern of witness intimidation, the defendant is remanded to federal custody without bail. Hyland went white. Your Honor, this is outrageous. Dr. Hyland, I suggest you remain silent. The judge turned to the prosecutor. The government has 30 days to file amended charges. Discovery will proceed on an expedited schedule. We're adjourned. The gavel fell. Federal marshals moved in to take Hyland away. He started shouting. His lawyers tried to calm him down. The courtroom descended into chaos. Emma slipped out a side door before the press could swarm her. Morris caught up with her in the hallway. That was just the beginning. We've got dozens of potential witnesses now. This is going to get bigger before it's over. I know. You still good to testify? Whenever you need me. Morris nodded. Get some rest. You look like hell. Emma almost smiled. Thanks. The MPs drove her back to base housing. She collapsed on the couch and slept for 12 hours straight. When she woke up, her phone had 147 new messages. Most were from reporters. Some were from people she'd served with in the Army. A few were from Mercy Ridge staff. One was from Sarah. Just wanted to let you know, 12 nurses submitted formal complaints today. We're not scared anymore. Emma stared at that message for a long time. Then she got dressed and headed back to Mercy Ridge. The hospital looked different somehow. Same building, same parking lot. But the atmosphere had shifted. People walked differently, talked differently, like a weight had been lifted. Emma badged in and went straight to ICU. General Carver was sitting up in bed, looking significantly better. Color back in his face, vitals strong. Captain? He gestured her over. Heard you had quite the morning in court. News travels fast. I have 3 aides whose entire job is keeping me informed. Of course it travels fast. He paused. You did good work, both in that OR and in that courtroom. I just told the truth. The truth is dangerous, especially when it threatens powerful people. Carver shifted in bed, grimacing slightly. I've seen a lot of officers over the years. The ones who last are the ones who understand that doing the right thing usually costs something. What did it cost you? Carver smiled faintly. My first marriage, 2 promotions I should have gotten, but didn't, and more friendships than I can count. He met her eyes. But I sleep fine at night. Can't say the same for the people who took the easy road. Emma checked his chart. Everything looked good, recovery progressing well. When are they transferring you to Walter Reed? Tomorrow morning. You coming with? That's the plan. Good. I hate flying with doctors who don't know what they're doing. Emma spent the rest of the day handling patient transfers and documentation. The work was tedious but necessary. Medicine happened in the margins between dramatic moments. Lab orders, medication reconciliation, notes that nobody read but everyone needed. She was finishing paperwork when Gerald Risch appeared. The hospital administrator looked even worse than before. His suit hung loose like he'd lost weight, dark circles under his eyes. Captain Cortez, do you have a moment? Emma gestured to an empty conference room. Risch closed the door and sagged into a chair. The board met again this afternoon. Emergency session. We're facing potential criminal charges, civil lawsuits, loss of accreditation. The whole hospital could go under. That's not my problem. I know. Risch rubbed his face. But I wanted you to know, we're implementing every recommendation the federal investigators suggested. New reporting procedures, independent oversight, mandatory training, everything. Little late for that. I know that too. He met her eyes. I spent 15 years protecting Marcus Hyland because he brought in money, because I told myself the complaints were exaggerated, because I was a coward who cared more about hospital finances than patient safety. Emma said nothing. I can't undo that, Risch continued, but I can make sure it doesn't happen again, and I can make sure everyone who enabled him faces consequences, including me. You offering to resign? Already did. Effective end of the month. The board's bringing in outside leadership to clean house. He stood. I just wanted to tell you that I'm sorry for not listening, for not believing you, for being part of the problem. He left before Emma could respond. She sat alone in the conference room, processing. Apologies didn't fix broken systems, but they were a start. Her phone buzzed. Agent Morris, new development. Need to meet. Same place as before. 1 hour. Emma drove to the federal building. Morris met her in the lobby, looking grim. What happened? Hyland's lawyers are playing hardball. They're filing motions to suppress the video evidence, claiming it was obtained illegally, arguing that Dr. Walsh violated wiretapping laws by recording without consent. Will it work? Maybe. Arizona is a one-party consent state, which means Walsh was legally allowed to record conversations she was part of. But Hyland's team is arguing that OR recordings fall under different rules because of patient privacy. Emma felt cold. If the videos get suppressed, we still have your testimony. We still have the assault charges. But it weakens the case significantly. Morris paused. There's something else. We've been getting pushback from hospital administration. Not Risch, he's cooperating fully, but the board. They've hired a crisis management firm, lawyers, PR people. They're preparing for war. Let them. It's not that simple. The hospital has deep pockets and powerful connections. They're going to fight this every step of the way. And they're going to come after anyone who threatens their reputation. Including me, especially you. Emma thought about that. What do you need from me? A full deposition, everything you saw, everything you experienced, documented in excruciating detail so Hyland's lawyers can't poke holes in it. When? Tomorrow, after you get General Carver settled at Walter Reed. Done. Morris studied her face. You're not scared at all, are you? I've been shot at by people who actually knew how to aim. Hospital lawyers don't scare me. He smiled slightly. I believe you. Emma left the federal building and headed back to base housing. The sun was setting, Phoenix spreading out below in a grid of lights and shadow. She thought about Marcus Hyland sitting in a federal holding cell, about Jennifer Walsh, whose career was destroyed the moment she came forward, about Sarah and the other nurses finally finding their voices, about a system that protected powerful men until someone forced it to change. Her phone rang. Unknown number. She almost didn't answer. This is Cortez. Captain Cortez. Female voice. Professional. My name is Victoria Marsh. I'm a producer with 60 Minutes. We're doing a story on workplace abuse in medical settings, and your case has drawn national attention. Would you be willing to sit down for an interview? Emma's first instinct was to say no. Then she thought about all the people who'd stayed silent because they were scared. All the patients who'd suffered because nobody spoke up. All the years Hyland got away with it because the system protected him. "Yes," she said, "I'll do the interview." "Excellent. We can schedule on one condition. You interview other people too. Nurses, residents, patients who were harmed. This isn't just my story." Marsh was quiet for a moment. "Agreed. We'll make it comprehensive." "Thank you, Captain." The call ended. Emma sat in her car outside base housing, knowing she'd just crossed a line she couldn't uncross. Going on national television meant exposing herself completely. No more privacy, no more anonymity, just her face and her story broadcast to millions of people. But maybe that was necessary. Maybe that was how you changed systems that didn't want to change. The next morning, Emma flew to Washington with General Carver. Military transport, no press, just medical staff and security. Carver spent most of the flight asleep. Emma monitored his vitals and reviewed transfer documents. Walter Reed was ready for them. Full trauma team standing by. They wheeled Carver straight to a private room with enough security to protect a head of state. Emma spent 3 hours briefing the Walter Reed surgeons on Carver's case. Every detail, every complication, every medication adjustment. When she finished, the lead surgeon, a colonel named Matthews, nodded approvingly. "Excellent work, Captain. The general's lucky you were there." "Just doing my job." "Most people don't do their job this well." Emma left Walter Reed and took a car to the federal building in downtown D.C. Agent Morris was waiting with a court reporter and 2 attorneys. The deposition took 6 hours. They went through everything. The initial confrontation with Hyland, the GERD patient, the appendectomy, the suspension, the assault. Every detail documented, every statement recorded, every question answered until Emma's voice was hoarse. When they finally finished, Morris looked satisfied. "That's solid testimony. Hyland's lawyers are going to have a hard time shaking this." "When's the trial?" "Probably 6 months out, maybe longer if his team keeps filing motions." Morris paused. "You prepared for this to drag on?" "I don't have a choice." "Actually, you do. You could settle, drop the charges in exchange for Hyland's resignation and financial compensation. His lawyers have already floated the idea." Emma stared at him. "Absolutely not." "I had to offer. It's standard. I don't care if it's standard. This isn't about money. It's about making sure he can't hurt anyone else." Morris nodded. "That's what I told them you'd say." Emma flew back to Phoenix that night, exhausted, drained, but oddly calm. The MPs drove her back to base housing. She collapsed into bed, still wearing her uniform. She woke 6 hours later to pounding on her door. Emma grabbed her sidearm, old habit from deployment, and approached carefully. "Captain Cortez, it's Lieutenant Diaz. We have a situation." Emma opened the door. The MP looked stressed. "What kind of situation?" "Someone leaked your address to the press. There are news vans outside the base perimeter. They're demanding access for interviews." Emma closed her eyes. "How did they find me?" "Unknown, but it gets worse. We're also getting reports of online harassment, threats against you, coordinated effort from multiple accounts." "How bad?" Diaz handed her a tablet. Emma scrolled through screenshots, social media posts calling her a liar, accusing her of destroying Hyland's life for attention, threatening violence. Some of them included photos of her address, her car's license plate. Emma felt her jaw tighten. "Who's coordinating this?" "We're investigating, but it looks professional. Someone with resources is funding this campaign." "Hyland's people." "That's our assumption." Emma handed back the tablet. "What do you recommend?" "Stay on base until this calms down. Don't engage with media. Don't respond to online harassment. Let us handle security." "And how long do I hide?" Diaz met her eyes. "As long as it takes to keep you safe, ma'am." Emma thought about that. Thought about spending months locked away while Hyland's team ran a smear campaign, while people who didn't know her decided she was the villain. "No." "Ma'am? I'm not hiding. Schedule the 60 minutes interview. I'm going on the record." "Captain, that could make things worse. Or it could make things better. Either way, I'm done letting other people control the narrative." Diaz looked uncertain, but nodded. "I'll pass that along to command." Emma spent the next 2 days preparing for the interview. Victoria Marsh's team sent pre-interview questions, background research, release forms. They scheduled the sit-down for Sunday evening, prime time, maximum visibility. Emma wore her dress uniform. Medals visible. Army insignia clear. Marsh was in her 50s, sharp-eyed and professional. She'd been doing investigative journalism for 30 years. She didn't waste time. Captain Cortez, let's start with what happened on the day Dr. Hyland assaulted you. Emma told the story. Calm. Clear. No embellishment. Marsh followed up. You saved a 16-year-old boy's life that day, yet you were suspended. How did that feel? Frustrating, but not surprising. That's how the system works. It protects people with power. Did you expect the situation to escalate the way it did? No, I expected to lose my job and move on. What I didn't expect was for General Carver to arrive bleeding out. That changed everything. Marsh leaned forward. Some people are saying you orchestrated this, that you provoked Dr. Hyland deliberately to create a situation you could exploit. Emma met her eyes. I can't control what people say, but I can tell you the facts. Dr. Hyland assaulted me because I questioned his medical judgment. Everything else followed from that. The interview went on for 2 hours. They covered the military investigation, the video evidence, the other victims coming forward. At the end, Marsh asked the question Emma had been dreading. What do you want people to take away from this story? Emma thought carefully. I want people to understand that systems don't change because powerful people suddenly decide to do the right thing. They change because someone stands up and refuses to back down. And I want anyone who's been hurt by someone in power to know that speaking up is hard, and it costs something, but it's worth it. The interview aired the following Sunday. 23 million people watched. By Monday morning, Emma's phone was exploding. Interview requests, speaking invitations, book deals. She ignored all of it. Instead, she went back to Walter Reed to check on General Carver. He was out of bed, walking with assistants, looking stronger every day. Saw your interview, he said. You handled yourself well. Thank you, sir. Stop calling me sir. I'm the one who owes you my life. Emma smiled faintly. How are you feeling? Like I got shot and had major surgery, but alive. He paused. I heard Major General Vance wants to talk to you about that medcom position. I've been avoiding her calls. Why? Because I don't know what I want anymore. Carver studied her face. What do you mean? Emma sat down. 3 weeks ago, I had a plan. Evaluate Mercy Ridge, write a report, move on to the next assignment. Now I'm the center of a federal case that's going to trial. I've got death threats. My face is all over the news, and I don't know where I fit in any of this. You fit wherever you decide to fit, Carver said. That's the privilege of being the person everyone else is talking about. You get to choose what comes next. And if I don't know what to choose, then you wait until you do. But don't hide. Don't let them make you disappear because it's easier for everyone else. Emma thought about that. Her phone buzzed. Agent Morris, trial date set. 8 months from now. Hyland's pleading not guilty to all charges. This is going to be a fight. Emma texted back. Good. I'm ready. She stayed at Walter Reed for another week, monitoring Carver's recovery and avoiding the press circus back in Phoenix. But eventually, she had to go back. The MPs drove her straight to the federal building. Morris was waiting with Agent Park and a U.S. attorney named Rebecca Santos. Santos was in her 40s, with the kind of presence that came from winning cases nobody thought she could win. Captain Cortez, thank you for coming in. They sat in a conference room. Santos pulled out a thick folder. Hyland's legal team is going scorched earth. They're attacking every piece of evidence, every witness, every procedure. They're spending millions on this defense. Let them spend. The problem is it's working. They've already gotten 2 witnesses to recant their statements. They're claiming the video evidence is inadmissible. And they're building a narrative that you're a disgruntled employee with a vendetta. Emma leaned back. What do you need from me? I need you to be perfect on that stand. No hesitation, no contradictions, no emotion that they can twist into bias. Santos met her eyes. They're going to tear into you, Captain. They're going to make you look like the villain. Can you handle that? Try me, Santos smiled grimly. I believe you can, but I need to prepare you for how ugly this gets. Mock cross-examination, opposition research. Every mistake you've ever made is going to come up in that courtroom. I've made plenty of mistakes. I know. We've already compiled them. 2 reprimands during your Army service. 1 malpractice complaint that was dismissed. A DUI from when you were 23. Emma felt cold. How did you? Same way Hyland's team did. Public records, background checks. They're going to use all of it to undermine your credibility. The DUI was 11 years ago. Doesn't matter, they'll make it matter. Santos pulled out another document. They're also going after your military service, questioning whether your combat experience makes you too aggressive, too quick to confrontation. That's insane. That's defense strategy. They don't need to prove you're lying. They just need to create enough doubt that the jury questions your motives. Emma stared at the folder full of her past mistakes. Every bad decision, every moment of weakness, all of it about to be displayed in front of a jury. When do we start preparing? Today. We have 8 months to build an airtight case. That means mock testimony, witness prep, strategy sessions. Santos paused. It also means your life is on hold until this trial is over. No media interviews without clearing them first. No social media, no public statements. Everything you do reflects on this case. Understood. They spent the next 6 hours going through Emma's testimony, Santos playing the role of hostile defense attorney, attacking every statement, every detail, every word choice. By the time they finished, Emma was exhausted. Morris walked her out. You did good in there. Santos is tough, but she knows what she's doing. How many cases has she won? 37 federal prosecutions, lost 3. She doesn't take cases she can't win. And she thinks we can win this one. Morris was quiet for a moment. She thinks it's 50-50, which in a case this high profile, against a defendant with unlimited resources, is pretty good odds. Emma absorbed that. 50-50. Flip a coin. What happens if we lose? Highland walks. Probably sues you for defamation, uses his money and connections to destroy everyone who testified against him. Morris met her eyes. And the message gets sent that powerful people can do whatever they want as long as they have good lawyers. Emma thought about that all the way back to base housing. 50-50 odds. 8 months of preparation. Her entire life dissected and displayed for a jury. And at the end of it, maybe justice. Maybe nothing. She was sitting on her couch staring at the wall when her phone rang. Jennifer Walsh. Emma answered. Dr. Walsh? I saw your interview. Walsh's voice was shaky. I wanted to call and say thank you for not backing down, for making this easier for the rest of us. You're the one who came forward with evidence. That took real courage. Courage or stupidity, I'm still not sure which. Walsh laughed bitterly. I've had 3 job interviews since the hearing. All of them went great until they ran my background check and found out I'm the resident who recorded her attending. Then suddenly, the positions were filled. I'm sorry. Don't be. I knew what this would cost. Walsh paused. But I wanted you to know, 8 more people have come forward since my testimony. Nurses, residents, even an attending who Highland threatened years ago. We're building something here, a case that's bigger than just one assault charge. That's good. It's terrifying, but yeah, it's good. Walsh was quiet for a moment. Captain Cortez, can I ask you something? Go ahead. Do you ever regret it, speaking up, starting all this? Emma thought about the death threats, the destroyed privacy, the 8 months of trial preparation ahead, the 50-50 odds. No, she said. I don't. How do you not regret it? Because staying silent would have been worse. Walsh absorbed that. Thank you. I needed to hear that. The call ended. Emma sat alone in her apartment, thinking about all the people whose lives had been upended because she'd refused to stay quiet, about the system that fought so hard to protect itself, about the trial that would decide whether any of it mattered. Her phone buzzed one more time. Message from an unknown number. You think you've won? You haven't. This is just beginning. By the time we're done, nobody will remember your name except as the soldier who lied. Emma stared at the message for a long time. Then she forwarded it to Agent Morris and deleted it. 8 months, 50-50 odds. She'd faced worse. Somewhere across the city, Marcus Highland was sitting in federal custody, surrounded by lawyers, plotting his defense. And somewhere in the darkness, people Emma would never meet were deciding whether she was a hero or a liar. Emma turned off her phone, closed her eyes, and waited for morning. When dawn came, she put on her uniform and prepared for war. The war began quietly. Not with dramatic courtroom confrontations or public accusations, but with the slow, methodical dismantling of Marcus Highland's empire, one document at a time. Agent Morris called Emma 3 weeks after the threatening message. We found something. You need to see this. Emma drove to the federal building. Morris and Park were waiting in their usual conference room, surrounded by financial records and spreadsheets that covered every available surface. Park didn't waste time. We've been tracing money, hospital payments, personal accounts, corporate entities. She pulled up a document on her laptop. Dr. Hyland has been running a side business for the past 7 years. Consulting firm, high-end medical advice for wealthy clients. Nothing illegal about that on the surface. Except, Morris continued, he was using Mercy Ridge resources to do it. Hospital equipment, hospital staff, hospital time, and he wasn't reporting any of it. Emma looked at the numbers. How much? Conservative estimate, $4 million over 7 years. All of it unreported income. All of it obtained through fraud. Park pulled up another screen. It gets worse. Some of his consulting clients were people he was already treating at Mercy Ridge. He was double billing, taking insurance payments for procedures at the hospital, then charging the same patients private fees for premium consultations that were just regular follow-up appointments. Emma felt something cold settle in her chest. That's insurance fraud. Federal insurance fraud, Morris confirmed. Medicare, Medicaid, military insurance through TRICARE. He billed government programs for services he never provided or provided substandard while pocketing private payments on the side. Can you prove it? Park smiled without warmth. We have 8 years of financial records, email confirmations, signed contracts, patient testimony. We can prove all of it. Morris leaned forward. Here's where it gets interesting. Some of the people he was defrauding, congressmen, state senators, federal judges, people with power who are very unhappy about being made to look like fools. Emma understood immediately. They'll want blood. They'll want more than blood. They'll want him destroyed publicly so everyone knows they weren't complicit. Morris pulled out a folder. The U.S. attorney is filing additional charges: wire fraud, tax evasion, conspiracy. We're looking at 20 years minimum if he's convicted on everything. Emma absorbed that. The assault charge alone would have been bad. This was career-ending, life-destroying. When are you filing? Tomorrow morning. We wanted you to know first. Park's expression softened slightly. This changes the trial. Hyland's lawyers are going to have a lot more to defend against, which means they're going to come at you even harder to try to create reasonable doubt on the assault charge. Let them come. Morris stood. There's one more thing. We've been monitoring Hyland's communications from custody. He's been making calls, a lot of calls, to people we're still identifying. You think he's coordinating the harassment campaign? We know he is. We just can't prove it yet, but we're working on it. Emma left the federal building and drove back to Mercy Ridge. She hadn't been back since the 60 Minutes interview aired. The hospital felt different now, quieter, like everyone was holding their breath waiting for the next explosion. She found Sarah in the ER, helping with a patient intake. The young nurse saw Emma and her face lit up. Captain Cortez, I didn't know you were back. Just checking in. How are things? Sarah glanced around to make sure they were alone. Different, better, mostly. The new interim chief of surgery is actually decent. He listens, doesn't scream. It's weird. Weird good or weird bad? Weird good. But people are still scared, like this is temporary and Hyland's going to come back somehow and make everyone pay. Emma understood that fear. He's not coming back. You sound sure. I am. Sarah studied her face. Something happened. What did you find out? Can't say yet, but it's big. Bigger than the video evidence? Emma thought about $4 million in fraud, about powerful people who'd been scammed, about 20 years in federal prison. Yeah, bigger. The news broke the next morning. Emma watched the press conference from her apartment. U.S. Attorney Rebecca Santos standing at a podium, flanked by Morris and federal prosecutors, announcing the new charges. Dr. Marcus Hyland is now charged with 18 counts of wire fraud, 12 counts of insurance fraud, conspiracy to defraud the United States, and tax evasion totaling over $2.3 million. These charges are in addition to the assault and obstruction charges previously filed. The reporters erupted with questions. Santos continued over them. The evidence in this case is extensive and overwhelming. Dr. Hyland used his position at Mercy Ridge Medical Center to defraud patients, insurance companies, and federal healthcare programs over a period of 8 years. The total financial impact exceeds $4 million. Emma's phone started buzzing. Messages from people she hadn't heard from in years. Former Army colleagues, medical school classmates, strangers who'd seen the news. One message stood out. From Jennifer Walsh. Holy shit, did you know about this? Emma texted back. Just found out yesterday. This changes everything. His lawyers can't spin this as a misunderstanding. This is black and white fraud. Emma hoped Walsh was right. The response came fast and brutal. Hyland's legal team held their own press conference that afternoon. His lead attorney, a man named Harrington who cost $1,000 an hour, stood in front of cameras looking like he'd been doing this for decades. These charges are politically motivated and factually baseless. Dr. Hyland is a decorated surgeon who has dedicated his life to saving lives. The government is attempting to destroy his reputation because they need a scalp to justify their overreach in the initial assault case, which itself is built on the uncorroborated testimony of a disgruntled employee with a documented history of insubordination. Emma watched from her apartment. Harrington was good, smooth, confident, the kind of lawyer who could make juries forget about evidence. He continued, Captain Emma Cortez has a pattern of conflict with authority. She was reprimanded twice during her military service. She has a prior DUI conviction. She was suspended from Mercy Ridge for interfering with surgical procedures. And now she's the centerpiece of a federal prosecution that conveniently elevates her from a failed nurse to a national hero. Ask yourself, who benefits from this narrative? The screen cut to news analysis. Talking heads debating whether Emma was credible, whether the charges were politically motivated, whether Hyland deserved the presumption of innocence. Emma turned off the TV. Her phone rang. Morris. You saw it? Yeah. Don't let it get to you. That's what they want. They're trying to shake you before trial. I know. Do you? Because Harrington is just getting started. He's going to dig up everything, every mistake, every bad decision, every moment of your life that doesn't fit the hero narrative. Emma was quiet for a moment. I never said I was a hero. I know. But the media did, and now Harrington's going to spend the next 8 months proving you're not. Then let him try. Morris sighed. Santos wants to meet. Mock trial prep. We need to start now. Emma spent the next 3 months living in conference rooms and courtrooms. Mock testimony, cross-examination practice. Santos playing the role of Harrington, attacking every word, every pause, every facial expression. You claim Dr. Hyland slapped you hard enough to draw blood, yet the medical examination shows only minor bruising. How do you explain that discrepancy? The bruising was consistent with, yes or no, Captain. Did the medical examination support your claim of violent assault? The examination showed yes or no. Emma gritted her teeth. The examination was conducted 6 hours after the incident. Bruising takes time to develop fully. So your answer is no. The immediate medical evidence did not support your dramatic claims. This went on for hours, days, weeks. Santos was relentless. You have to be better, she said after one particularly brutal session. Harrington will twist everything. Every hesitation becomes doubt. Every clarification becomes backtracking. You need to answer directly and move on. Emma tried again, and again, and again. Meanwhile, the investigation continued expanding. Agent Park brought Emma updates weekly. We've identified 43 victims of Hyland's fraud scheme, patients who were billed for services they didn't receive or charged twice for the same procedure. Most of them didn't even realize it. Are they willing to testify? Some. Others are scared. Hyland's lawyers have been sending letters threatening lawsuits against anyone who cooperates with the prosecution. Can they do that? Park smiled grimly. They can threaten. Whether it's legal is another question, but it's working. 3 witnesses have already backed out. Emma felt frustration building. What about the video evidence, Walsh's recordings? Still fighting to get them admitted. Hyland's team is arguing they violate patient privacy because they were recorded in operating rooms. Judge hasn't ruled yet. And if they're excluded, then we build the case on financial records and victim testimony. It's harder, but doable. Emma went back to Walter Reed to check on General Carver. He was recovering well, walking without assistance now, color back, strength returning. You look stressed, he observed. Trial prep. How's it going? Like getting interrogated for 8 hours straight every day. Carver nodded. Santos is tough, but she knows what she's doing. Trust the process. I'm trying. He studied her face. Something else bothering you? Emma sat down. I keep thinking about all the people who came forward. Walsh, Sarah, the other nurses. They destroyed their careers to testify, and now Hyland's lawyers are threatening to sue them into bankruptcy. What if we lose? What happens to them? Then they'll rebuild. Same as you will. Carver leaned back. Look, I've been in command long enough to know that doing the right thing doesn't come with guarantees. Sometimes you win, sometimes you lose. But you don't make decisions based on fear of losing. Easy to say when you're not the one facing 20 years in prison if the case falls apart. Highland's facing 20 years. You're facing the possibility of losing a lawsuit. There's a difference. Emma knew he was right, but it didn't make the waiting easier. 5 months before trial, the judge ruled on the video evidence. Emma was in a strategy session with Santos when Morris burst in. Videos are in. Judge ruled they're admissible. All of them. Santos's face showed the first genuine smile Emma had seen from her. That changes everything. Harrington can spin testimony, but he can't spin video of Highland throwing surgical instruments at residents. He'll try, Morris said. But yeah, this is huge. The trial date got bumped up. Instead of 8 months out, they were looking at 3. Santos immediately shifted into high gear. We need to finalize witness order, lock down testimony, prepare exhibits. Emma, you're going to be on that stand for at least 2 days, maybe 3. We need you ready. The mock sessions intensified. Santos brought in a jury consultant, a woman named Dr. Patricia Ross, who'd spent 30 years studying how juries made decisions. Ross watched Emma testify, then pulled her aside. You're too controlled, too military. Juries need to see emotion. I'm testifying about facts. Facts don't convict people. Stories convict people. Right now you're telling facts. You need to tell your story. Emma bristled. I'm not performing for a jury. Yes, you are. That's exactly what testimony is. Performance, controlled, truthful, but still performance. Ross softened her tone. I'm not asking you to lie or exaggerate. I'm asking you to let the jury see what you felt. Fear when Highland cornered you, shock when he hit you, determination when you saved General Carver's life. Those emotions make you human. Right now you're a robot reciting facts. Emma thought about that. The next mock session, she tried letting her guard down slightly, showing the moment of fear before the slap, the flash of anger afterward, the exhaustion during surgery. Santos nodded approvingly. Better. Keep that. 2 months before trial, Highland's team made a settlement offer. Santos called Emma to the federal building to discuss it. They're offering full resignation from Mercy Ridge, permanent surrender of medical license, public apology, and $5 million in damages. In exchange, you drop all charges and sign an NDA. Emma stared at her. $5 million. Tax-free. Plus, he loses his license permanently. He'll never practice medicine again. But he stays out of prison. Yes. Emma thought about $5 million. About financial security for the rest of her life. About not having to testify. About ending this nightmare. No. Santos didn't look surprised. You sure? That's generational wealth, and we still might lose at trial. I'm sure. This isn't about money. It's about making sure he faces real consequences. Real consequences like 20 years in federal prison? Exactly like that. Santos nodded slowly. Okay, I'll tell them the offer's rejected. What will they do now? Get desperate, which makes them dangerous. Santos met her eyes. Harrington knows his client is guilty. He knows the evidence is overwhelming. His only play is to destroy your credibility so completely that the jury can't trust anything you say. Expect it to get ugly. It got ugly fast. Harrington's team started leaking information to the press. Stories about Emma's DUI, her military reprimands, a malpractice complaint from a patient who died during her care. Never mind that the complaint was dismissed after review, found Emma had performed flawlessly. The media ran with it. Headlines questioning whether Emma was really the hero everyone thought. Op-eds suggesting she had a vendetta against successful men. Anonymous sources claiming she was difficult to work with. Sarah sent Emma a screenshot of a news article. The headline read, Army Surgeon or Attention Seeker? The Complicated Truth About Emma Cortez. Emma read it once, then deleted it, but the damage was spreading. She started getting recognized in public. People staring, whispering, some supportive, others hostile. She was buying groceries when a woman approached her in the checkout line. You're that captain, the one who got that doctor arrested. Emma nodded carefully. Yes, ma'am. My husband's a surgeon. He says you're destroying a good man's career because you couldn't handle being corrected. Emma felt every eye in the store turn toward her. I appreciate your husband's opinion, but people like you are what's wrong with this country. Always looking for someone to blame instead of taking responsibility. The woman walked away before Emma could respond. Emma paid for her groceries in silence and left. She was sitting in her car in the parking lot when her phone rang. Unknown number. Against her better judgment, she answered. Captain Cortez? Male voice. Young, nervous. Who is this? My name is David. I'm a medical student at ASU. I don't know if you remember me, but I was working at Mercy Ridge when everything happened. I was rotating through surgery. Emma vaguely remembered him. Quiet kid, stayed in the background. What can I do for you, David? I have something. Evidence. I didn't know what to do with it, but after seeing everything in the news, I think you should have it. Emma's pulse quickened. What kind of evidence? A recording. From the day Dr. Hyland hit you. I was wearing a body camera. We all were. It's part of our documentation training. But I never turned mine in because... He trailed off. Because I was scared. Hyland scared me. He scared everyone. Do you still have the recording? Yes. It shows everything. The whole confrontation, everything he said, everything you said, the slap, all of it. Emma's mind raced. Have you told anyone else about this? No, just you. Should I call the investigators? Yes, immediately. Ask for Agent Morris. Give him the recording. Do it today. Okay, I will. I wanted to say I'm sorry for not coming forward sooner. You probably would have had an easier time if I'd... David, Emma cut him off gently. You're coming forward now, that's what matters. Make that call. She hung up and immediately called Morris. We have a problem, she said, or maybe a solution. I'm not sure which. She explained about David and the body camera footage. Morris was quiet for a long moment. If that recording is as clear as this kid says, it's game over. No amount of spin can overcome video of Hyland assaulting you. That's what I thought. But it also means Harrington is going to lose his mind. He'll challenge admissibility. He'll claim it's fabricated. He'll throw everything at it. Can he get it excluded? Doubtful. Not if it's authenticated properly. But he'll try. Morris paused. Get that kid to call me immediately. We need that recording secured before someone makes it disappear. 2 hours later, David delivered the footage to the federal building. Emma watched it with Morris, Santos, and Park in a secure viewing room. The video was crystal clear, body-worn camera mounted on David's chest, capturing everything at eye level. It showed Emma standing in the surgical corridor, showed Hyland approaching, his face already twisted with anger. The audio picked up every word. You think you can make me look incompetent in front of my staff? Emma's voice, calm. I was providing clinical observation, Dr. Hyland. You were undermining my authority, questioning my judgment, making me look like I don't know what I'm doing. That wasn't my intention. I don't care about your intentions. I care about you learning your place. Then the slap, clear, undeniable, the sound of flesh on flesh making everyone in the viewing room flinch. The video showed Emma touching her mouth, showed the blood, showed her standing there, not fighting back, just staring at him. Then the alarm started. The video ended. Santos leaned back in her chair. That's the case. Right there. 12 seconds that prove everything. Park was already on her laptop. I'm checking metadata now. Date stamp matches. File hasn't been altered. This is authentic. Morris looked at Emma. How did you stay that calm? He just hit you and you barely reacted. Emma thought about that moment. The shock. The cold fury underneath. The decision to stay controlled because losing control would have given him exactly what he wanted. Training, she said simply. Santos stood. We need to get this into evidence immediately. Harrington's going to fight it, but this is too clear to exclude. They filed the new evidence that afternoon. Hyland's legal team exploded exactly as predicted. Emergency motions, challenges to authenticity, claims that the body camera footage violated hospital privacy policies, arguments that it should have been turned over during discovery. The judge heard arguments the next morning. Emma sat in the gallery and watched Harrington work. He was good, passionate, made it sound like this was a conspiracy instead of a medical student finally finding courage. But Santos was better. Your Honor, this video is authenticated. It's unaltered. It shows exactly what Captain Cortez testified to in her depositions. The defense's objections are procedural smokescreens designed to hide the fact that this evidence destroys their entire narrative. The judge considered. I'm inclined to agree. Motion to exclude is denied. The video will be admitted into evidence. Harrington's face went white. Emma felt something release in her chest. Not relief exactly, just the knowledge that the truth was going to be seen. The trial started 3 weeks later. Phoenix Federal Courthouse, media circus outside, security everywhere. Emma walked through protesters, half supporting her, half calling her a liar, and entered the building with MP escort. Inside, the courtroom was packed. Press, hospital staff, military personnel, curious citizens who'd followed the case. Hyland sat at the defense table looking smaller than Emma remembered. Prison had aged him. Gray in his hair now, lines around his eyes. But when he looked at her across the courtroom, his eyes held nothing but hate. Judge Patricia Morrison took the bench. Federal judge. 20 years on the bench. No-nonsense reputation. Ladies and gentlemen of the jury, we're here for the trial of United States versus Marcus Hyland. Opening statements will begin shortly. Santos went first. She was brilliant. Laid out the case in clear, simple language. The assault, the fraud, the pattern of abuse. She didn't oversell it. Just facts. Timeline. Evidence. Then Harrington stood. Ladies and gentlemen, this case is about a woman scorned. Captain Emma Cortez came to Mercy Ridge with an agenda. She wanted to be a surgeon, but she wasn't qualified. When Dr. Hyland pointed out her limitations, she decided to destroy him. Everything you'll hear from the prosecution is built on this foundation of personal vendetta. Emma forced herself to stay expressionless. The first week of trial was witnesses. Nurses testifying about Hyland's abuse, residents describing thrown instruments and death threats, financial experts explaining the fraud. Harrington cross-examined each one brutally, finding contradictions, attacking credibility, making them seem uncertain. But the videos were coming. Emma knew that. Walsh's recordings and David's body camera footage. Those would be the turning point. On day 8, they played the first video. Hyland screaming at a resident, throwing a surgical tray across the OR, the resident ducking, the crash of instruments hitting the wall. The jury watched in silence. They played 5 more videos that day, each one showing Hyland at his worst, abusive, violent, dangerous. The jury's expression shifted from neutral to disturbed. On day 9, they played David's body camera footage. The courtroom went dead silent as the slap echoed through the speakers. Emma watched the jury, saw them flinch, saw their faces harden. Harrington tried damage control during cross-examination. Dr. Hyland was under extreme stress. Captain Cortez had been insubordinate multiple times. This was an unfortunate moment, but an unfortunate moment, Santos objected. That's assault, counsel, not an unfortunate moment. Sustained, Judge Morrison said quietly. On day 12, Emma took the stand. Santos walked her through everything. The GERD patient, the appendectomy, the suspension, the assault, General Carver's surgery. Emma answered clearly, calmly, letting the emotion show when appropriate but staying controlled. Then Harrington stood for cross-examination. Captain Cortez, you have a history of conflict with authority figures, don't you? I've had disagreements with supervisors when patient safety was at risk, including receiving official reprimands during your military service. Yes, one for refusing an order that would have compromised patient care, another for insubordination when I reported a superior for medical negligence. So you have a pattern of thinking you know better than your superiors. Emma met his eyes. I have a pattern of prioritizing patients over politics. The judge intervened before Harrington could respond. Counsel, move on. Harrington tried another angle. You claim Dr. Hyland slapped you unprovoked, but you'd been undermining him all day, hadn't you? I'd been doing my job. Your job was to follow his orders. My job was to provide safe patient care. When his orders contradicted that, I spoke up. And when he corrected you, you couldn't handle it. When he assaulted me, I reported it. Harrington's jaw tightened. He spent 2 more hours trying to shake her. Emma held firm on every question. When she finally stepped down, she saw the jury looking at her differently. Not hostile, not quite sympathetic, but believing. The prosecution rested. Hyland's defense lasted 3 days. Character witnesses, expert testimony claiming the financial irregularities were accounting errors, a psychiatrist suggesting Hyland had been under extreme stress. None of it mattered after the videos. Closing arguments came on day 18. Santos stood before the jury. You've seen the evidence. You've heard the testimony. You've watched Dr. Marcus Hyland abuse, assault, and defraud. The question isn't whether he's guilty. The question is whether you have the courage to hold a powerful man accountable. Harrington tried to rally. The government wants you to destroy a man's life based on the testimony of a disgruntled employee and some out-of-context videos. Don't let emotion override evidence. The jury deliberated for 6 hours. When they returned, Emma was sitting in the gallery between Lieutenant Colonel Hayes and Agent Morris. Has the jury reached a verdict? The foreman stood. Older woman, retired teacher based on jury selection. We have, Your Honor. On the count of assault and battery of a federal officer, how do you find? Guilty. Emma's breath caught. On the count of wire fraud? Guilty. Insurance fraud? Guilty. Guilty on all counts. Every single one. The courtroom erupted. Judge Morrison banged her gavel for order. Highland sat frozen at the defense table, staring at nothing. Sentencing was scheduled for 6 weeks out. Emma left the courthouse through a side entrance, avoiding the press mob. The MPs drove her straight back to base housing. She sat alone in her apartment, processing, guilty, on everything. Marcus Highland was going to federal prison. Her phone started buzzing, messages pouring in. Sarah, Walsh, people from Mercy Ridge, former Army colleagues. One message stood out, from General Carver, Justice. Well done, Captain. Emma stared at that message for a long time. Then she turned off her phone and slept for 14 hours straight. 6 weeks later, she returned to court for sentencing. Judge Morrison looked down at Highland with an expression of cold fury. Dr. Highland, you took an oath to do no harm. Instead, you spent years harming patients, staff, and the institutions that trusted you. You showed no remorse, no accountability, no recognition of the damage you caused. She paused. 18 years in federal prison, no possibility of parole, medical license permanently revoked, mandatory restitution to all victims. Highland's head dropped. Federal marshals took him away in handcuffs while cameras flashed. Emma watched him disappear through the side door and felt something she hadn't felt in months. Peace. Outside the courthouse, Santos pulled her aside. You did it. You held him accountable when the system tried to protect him. We did it. No. Santos met her eyes. You did it. By refusing to back down. By standing up when it would have been easier to walk away. That's all you. Emma didn't know what to say to that. Morris and Park joined them. What now, Captain? Morris asked. Emma thought about that question. What now? She'd spent a year fighting, preparing, testifying, surviving. And now it was over. I don't know, she admitted. Major General Vance is still waiting for your answer about the Medcom position, Hayes said, appearing from the crowd. Emma had forgotten about that offer. It felt like a lifetime ago. I need time to think. Take all the time you need. The offer's not going anywhere. Emma left the courthouse and drove to Mercy Ridge. The hospital looked the same as always, but when she walked through the doors, people stopped her. Nurses, residents, support staff. Thank you, one nurse said quietly. You saved us, another whispered. Sarah was waiting in the ER. She threw her arms around Emma without asking permission. He's gone. He's really gone. He's really gone, Emma confirmed. Jennifer Walsh appeared, looking lighter somehow, like a weight had been lifted. I got a job offer, she said. Johns Hopkins, surgical residency. They said what I did took courage, and they want people like that in their program. Emma felt genuine happiness for the first time in months. That's incredible. It's because of you. Because you showed us that speaking up was possible. Emma shook her head. You came forward on your own. That was all you. She spent an hour walking through Mercy Ridge, seeing the changes, the new leadership, the staff who walked without fear. Then she left and drove back to her apartment. A package was waiting at her door. No return address. Emma opened it carefully. Inside was a handwritten letter and a military commendation. The letter was from General Carver. Captain Cortez. By the time you read this, Highland will be behind bars where he belongs. You did that. Not the system, not the investigators. You. I've recommended you for the Soldier's Medal for your actions during my surgery. The recommendation has been approved. Ceremony is in 3 weeks at the Pentagon if you choose to attend. More importantly, I've been talking to people who matter, about reforming how the military handles medical partnerships with civilian hospitals, about creating oversight programs that prevent situations like Mercy Ridge from happening again, about putting people like you in positions where you can make real change. That Medcom position Vance offered you? It's been expanded. Director of Military-Civilian Medical Integration. You'd be overseeing partnership programs nationwide, making sure hospitals that work with military personnel meet actual standards, building systems that protect people instead of protecting institutions. The job's yours if you want it. Think about it. Carver. Emma read the letter 3 times, Director of Military-Civilian Medical Integration, a position that didn't exist 6 months ago, created specifically because of what happened at Mercy Ridge. She thought about all the nurses and residents at hospitals across the country who were dealing with their own versions of Marcus Hyland, all the people who stayed silent because the system protected the wrong people. She thought about being able to change that system from the inside. Her phone rang. Unknown number again. She answered. Captain Cortez, this is Amanda Sterling from the Washington Post. We're doing a long-form investigation into medical abuse in civilian hospitals with military contracts. Your case is the centerpiece, but we're expanding it. We've found evidence of similar patterns at 17 other facilities. Would you be willing to speak with us? Emma thought about 17 other hospitals, 17 other Marcus Hylands, potentially hundreds of victims. Yes, she said. I'll talk to you. The article ran 3 months later. It was devastating. Hospital after hospital where abuse had been covered up, where powerful doctors had operated unchecked, where the system had failed everyone except the people it was supposed to regulate. Congress launched investigations. The Department of Defense opened formal reviews of every military hospital partnership. Mercy Ridge lost its military contract permanently, and Emma Cortez became the face of reform. She took the MedCom position, started implementing new protocols, mandatory reporting systems, independent oversight, protection for whistleblowers. 6 months after Hyland's sentencing, she gave a speech at the Army War College. 200 medical officers in the audience, all of them watching her. The system doesn't change because people in power suddenly decide to do the right thing, she said. It changes because someone refuses to accept that this is just how things are. Someone stands up, someone speaks out, someone says not anymore. She paused, looking out at the faces watching her. I'm not special. I'm not brave. I just refuse to stay silent when it mattered, and if I can do that, so can you. The applause was thunderous. Afterward, a young captain approached her. Female, early 30s, nervous. Ma'am, I'm stationed at Fort Campbell. I'm having issues with my commanding officer. Medical malpractice, abuse. I've been trying to report it, but everyone keeps telling me to handle it through proper channels, and proper channels keep burying it. Emma looked at her, saw herself 2 years ago, scared, angry, alone. Tell me everything, she said. They talked for 2 hours. Emma took notes, made calls, put the captain in touch with investigators who would actually listen. When the captain left, she looked like she could breathe again. Emma sat alone in her hotel room that night, thinking about how far she'd come. From a suspended nurse facing termination to the architect of military medical reform. From someone nobody believed to someone who'd taken down one of the most powerful surgeons in the country. From silence to testimony to change. Her phone buzzed. Message from Sarah. Just saw your speech online. You're amazing. Also, one of the residents who testified against Hyland just got appointed to the hospital ethics board. Things are changing, really changing. Emma smiled. Then another message came through. Unknown number. You destroyed a great man's career and sent him to prison for defending himself. You're a liar and a fraud. But don't worry. Truth always comes out eventually, and when it does, you'll pay for what you did. Emma stared at the message. Then she forwarded it to Morris and blocked the number. Some battles never really ended, but that was okay. She'd faced worse. And somewhere in a federal prison, Marcus Hyland was learning that power wasn't something you owned. It was something you earned. And once you lost it, no lawyer in the world could get it back. Emma deleted the threatening message and went to bed. But sleep didn't come easy. She lay in the darkness of her hotel room thinking about the captain from Fort Campbell, about the fear in that young woman's eyes, about how many others were out there right now, dealing with their own versions of Marcus Hyland. Her phone buzzed at 3:47 a.m., Agent Morris. Nobody called at that hour unless something had broken. Talk to me. We traced that threatening message you forwarded. Burner phone registered to a shell corporation. We dug deeper. Morris paused. Hyland's family hired a private investigation firm. They're trying to build a case that you fabricated evidence. They've been contacting witnesses, offering money for recantations. Emma sat up. Did anyone take it? 2 people. Both recanted their testimony yesterday. Said they were pressured by federal agents to lie. That's bullshit. I know, but it's going to hit the news cycle by morning. Hyland's family is funding a PR campaign. They're positioning him as the victim of government overreach and a vindictive accuser. Emma felt cold anger settle in her chest. He's in federal prison, convicted on all counts. What do they think they're going to accomplish? Appeal. public sympathy. Maybe a reduced sentence. They've got money and they're not going quietly. Morris's voice hardened. But here's the thing. We've been monitoring their communications. The investigator they hired crossed some lines. Witness tampering, bribery. We're building a case. How long until you can move? Week, maybe 2. But Emma, you need to be ready. This is going to get nasty before it gets better. The news broke 6 hours later. Emma was in a briefing at the Pentagon when her phone started exploding with notifications. She stepped out into the hallway and pulled up the headlines. Highland family claims evidence fabrication. 2 witnesses recant testimony. Was Army Captain Emma Cortez part of federal conspiracy? The articles were everywhere. Conservative media running with the story hard. Liberal outlets pushing back but raising questions. Social media on fire with people picking sides. Emma's hands didn't shake. They never did. But she felt the weight of it pressing down like she was back in that field hospital in Kandahar with mortars falling and patients bleeding out faster than she could save them. Her phone rang. Rebecca Santos. Don't respond to anything. No statements. No interviews. Let me handle this. I can defend myself. I know you can. But right now, silence is your best weapon. They want you emotional. They want you making mistakes. Don't give them the satisfaction. Santos was right. Emma knew she was right. But every instinct screamed to fight back. She went back into the briefing and focused on work. Military hospital inspections, new oversight protocols, the boring, unglamorous labor of actually changing systems. But her mind kept drifting to those recanted testimonies, to people she thought had courage, suddenly folding under pressure. That evening, she drove to Mercy Ridge. She hadn't been back since taking the medcom position. The hospital felt different now, quieter, cleaner somehow, like something toxic had been scrubbed away. She found Sarah in the ER, wrapping up a shift. The young nurse saw Emma and immediately pulled her into an empty supply closet. Have you seen the news? Yeah, it's garbage. Everyone here knows it's garbage. Those 2 people who recanted? One of them was already known for being sketchy. The other got paid $50,000 by Highland's family. We have proof. Emma's pulse quickened. What kind of proof? Bank records. One of the other nurses used to date the guy who recanted. He told her about the money, bragged about it. She recorded the conversation and gave it to the federal investigators this morning. Emma felt something loosen in her chest. Does Santos know? If she doesn't yet, she will in about an hour. The nurse is meeting with her tonight. Emma left Mercy Ridge and drove to the federal building. Morris met her in the lobby. We got the recording. It's clean. Guy admits on tape that Highland's family paid him to recant. Says they promised more money if he could get others to flip too. Can you use it? Morris smiled grimly. Already submitted it to the judge. We're filing charges against the private investigator and 2 members of Highland's legal team for witness tampering. This whole thing just backfired spectacularly. The story shifted overnight. By morning, headlines were running the opposite direction. Highland family accused of witness tampering. Federal investigators file new charges. Convicted surgeons' appeals crumble. Emma watched it unfold from her office at the Pentagon. The media cycle was brutal and fast. Yesterday she'd been the villain. Today she was vindicated. Tomorrow it would be something else. She'd stopped caring what the news said about her. What mattered was the work. She spent the next 3 months implementing the new oversight program, visiting military hospitals across the country, meeting with staff, listening to complaints that had been buried for years. At Naval Hospital Camp Pendleton, a nurse pulled her aside. There's a surgeon here. Same pattern as Highland. Abuse. Threats. We've reported him 6 times. Nothing happens. Emma took notes. Made calls. Within 2 weeks, federal investigators were on site. Within a month, the surgeon was suspended pending investigation. At Walter Reed, a resident approached her after a training session. I watched your trial. Read everything about what you did. It gave me the courage to report my attending for falsifying patient records. They're investigating now because of the protocols you created. Emma felt something shift inside her. Not pride exactly, just the knowledge that the pain had meant something. At Fort Bragg, she ran into Lieutenant Colonel Hayes. Captain Cortez, or should I say Major Cortez? Emma blinked. Sir? Hayes handed her an envelope. Your promotion came through, effective immediately. Congratulations, Major. Emma opened the envelope with shaking hands. Official orders. Promotion to Major. Dated and signed by a 2-star general. I didn't apply for promotion. You didn't have to. Your record speaks for itself. Combat experience, exemplary performance under pressure, successfully prosecuting corruption, building systems that protect service members. The board voted unanimously. Emma stared at the orders, processing. Major. She'd enlisted as a private 11 years ago, worked her way through medical school on military scholarships, deployed 3 times, saved lives in conditions that would break most people, and now this. Thank you, sir. Hayes smiled. Don't thank me. You earned it. That evening, Emma drove back to Phoenix for the first time in months. The city looked the same, but felt different, like a chapter that was closing. She stopped at her old apartment. Most of her stuff was still there, boxed up, but not moved. She'd been living out of hotels and temporary housing since the trial ended. She started packing, really packing this time, deciding what to keep and what to let go. In the back of her closet, she found her old nursing scrubs from Mercy Ridge, the ones she'd been wearing the day Highland hit her. There was still a small blood stain on the collar. Emma held them for a long moment. Then she threw them away. She was loading boxes into her car when her phone rang. Unknown number. She almost didn't answer. This is Cortez. Major Cortez. Male voice, older, gravelly. My name is Robert Highland. Marcus is my brother. Emma went very still. What do you want? To apologize. That was the last thing Emma expected. I'm listening. Robert Highland took a shaky breath. I paid that investigator. I authorized the witness tampering. I thought my brother was being railroaded, that you were lying, that the government was out to get him. And now? Now I've seen all the evidence. The videos, the financial records, the testimony. His voice cracked. My brother is a monster, and I enabled him. I spent 18 months and almost $2 million trying to defend the indefensible because I couldn't accept what he'd become. Emma didn't know what to say. I'm not asking for forgiveness, Robert continued. I'm just asking that you know I was wrong about everything, and I'm cooperating fully with the federal investigation into the witness tampering. I'll plead guilty to whatever they charge me with. Why are you telling me this? Because you deserve to hear it. Because my family destroyed your reputation for doing the right thing. Because I'm sorry. The line went dead. Emma stood in her parking lot holding her phone, trying to process what just happened. An apology from a Highland. She didn't know what to do with that. She finished packing and drove to D.C. Her new apartment was in Arlington, small but nice, close to the Pentagon, a real home for the first time in years. She spent the weekend unpacking and trying to build something that felt normal. Monday morning, she was back at work. Her office was in a secure wing of the Pentagon. Small desk, computer, filing cabinets full of hospital inspection reports. Her assistant, a sharp Army lieutenant named Kim Rodriguez, knocked on the door. Ma'am, you have a visitor, General Carver. Emma stood immediately. Carver walked in looking significantly better than the last time she'd seen him. Color back, moving easily, no sign of the trauma that had nearly killed him. General? Major, he grinned. Heard about the promotion. Well deserved. Thank you, sir. How are you feeling? Good as new. Doctors cleared me for full duty next month. He sat down. I'm actually here on official business. The Secretary of Defense wants to meet with you. Emma blinked. Sir? Your hospital oversight program is working. We've identified corruption at 6 facilities, prevented abuse at a dozen more, saved lives. The Secretary wants to expand it, make it permanent, full funding, staff, authority to investigate any military medical facility in the world. Emma absorbed that. That's a massive undertaking. It is, which is why you'd be promoted to lieutenant colonel and given command of the entire operation. You'd report directly to MedCom leadership, full autonomy, budget authority, the works. Emma stared at him. Lieutenant colonel, that's 2 ranks above where you are now, I know. But the Secretary doesn't want this program to be some temporary initiative that gets defunded in 3 years. She wants it institutionalized, and she wants you running it. When does she need an answer? End of the week. Carver stood. Think about it. But between you and me, you'd be crazy to turn it down. Emma spent 3 days thinking. Lieutenant colonel, running a program that could prevent what happened at Mercy Ridge from happening anywhere else. Real authority, real resources, real change. But it also meant giving up clinical medicine. No more surgery, no more patients, just administration and oversight. She called Jennifer Walsh. I need advice. Walsh laughed. From me? You're the one who took down a corrupt hospital and changed military policy. What could I possibly advise you on? I'm being offered a promotion. Big one. But it means giving up practicing medicine. Walsh was quiet for a moment. What do you want to do? I don't know. Part of me misses surgery, misses the OR, misses saving lives directly. And the other part? The other part knows I can save more lives by fixing broken systems than I ever could with a scalpel. Then you have your answer. Emma sat with that for another day. Then she called Carver. I'll take it. The promotion ceremony was at the Pentagon. Formal dress uniforms, flags, generals. Emma stood at attention while the Secretary of Defense pinned Lieutenant Colonel insignia on her collar. Lieutenant Colonel Emma Cortez, you are hereby promoted and assigned command of the Military Medical Oversight Division. Congratulations. The applause was loud. Emma saw faces in the crowd. Lieutenant Colonel Hayes, Agent Morris, Rebecca Santos, Sarah from Mercy Ridge, Jennifer Walsh, even General Carver in his dress uniform looking proud. After the ceremony, Emma stood in the hallway accepting congratulations. Sarah hugged her hard. You did it. You really did it. We did it. All of us. Walsh shook her hand. I start at Johns Hopkins next month. New program, new life. None of it would have happened without you. You gave me the evidence that mattered. That was all you. Morris appeared, looking as serious as ever. Lieutenant Colonel? Has a nice ring to it. Thanks for everything, Agent Morris. This doesn't happen without your investigation. Just doing my job. But for what it's worth, you're one of the toughest people I've ever worked with, and I've worked with a lot of tough people. Santos was the last to approach. How does it feel? Emma thought about that question. Strange. Good. Like I can finally breathe. You earned this, every bit of it. Santos paused. Hyland's appeal was denied yesterday. He's serving the full 18 years, no early release. Emma nodded. She'd stopped following Hyland's case months ago. It didn't matter anymore. That evening, Emma drove to Mercy Ridge one last time. The hospital was quiet. Evening shift. Controlled chaos in the ER. She walked through the corridors where everything had happened. The surgical wing where Hyland had slapped her. The OR where she'd saved the appendectomy patient. The trauma bay where General Carver had arrived bleeding out. She stood in the spot where her life had changed and felt nothing but peace. A nurse she didn't recognize walked by, then stopped. You're her, the captain who took down Dr. Hyland. Lieutenant Colonel now, but yeah. The nurse smiled. I transferred here after he was gone. People still talk about what you did, how you stood up when everyone else was too scared. You saved this place. I didn't save anything. I just refused to stay quiet. Sometimes that's the same thing. Emma left Mercy Ridge and drove to a diner she used to go to during her brief time working there. Same booth in the back. Same bad coffee. Same view of the highway. She sat there for an hour, watching traffic pass, thinking about the journey from that first day at Mercy Ridge to here. 18 months, that's all it had been. 18 months that felt like a lifetime. Her phone buzzed. Message from Rodriguez, her assistant. Ma'am, we received a complaint from Fort Hood, orthopedic surgeon. Multiple allegations of abuse. Staff is requesting investigation. How do you want to proceed? Emma stared at the message. Here it was. The work. The reason she'd accepted this position. She typed back. Full investigation. I'll be on site Monday. Get me everything. Personnel files, complaint history, witness list, and contact the base commander. Tell them we're coming in with full authority. Rodriguez responded immediately. Yes, ma'am. Files will be ready. Emma paid for her coffee and left. The drive back to Arlington took 4 hours. She spent it thinking about Fort Hood, about the surgeon who thought he was untouchable, about the staff who were scared to speak up, about how that was going to change. She arrived home past midnight. Her apartment was dark and quiet. She turned on one lamp and sat on her couch, looking at the boxes she still hadn't fully unpacked. On her coffee table was the Army Soldier's Medal that General Carver had recommended her for. Silver and blue ribbon. For heroism not involving combat. Next to it was a framed photo someone had sent her. Emma standing outside the federal courthouse after Hyland's conviction. She looked exhausted, determined, unbreakable. Her phone rang. She almost didn't answer because it was so late, but the number looked familiar. Hello? Major Cortez? Young woman's voice, scared. My name is Lieutenant Sarah Kim. I'm stationed at Fort Benning. I'm a surgical resident, and my attending he's been hurting people, patients, staff. I tried to report it, but nobody will listen, and I didn't know who else to call. And then I saw your story, and I thought maybe you could help." Emma sat up straighter. "Tell me everything." They talked for 90 minutes. Emma took detailed notes, asked questions, listened to the fear and frustration and desperate hope in this young lieutenant's voice. When they finished, Emma made a promise. "I'll be at Fort Benning by the end of the week. I'll investigate personally. And Lieutenant Kim, you did the right thing by calling. You're not alone anymore." The lieutenant started crying. Thank you so much." Emma hung up and immediately called Rodriguez. "I need a team assembled for Fort Benning. Full investigation. We leave Friday." "Yes, ma'am. I'll coordinate with base command." Emma set down her phone and looked out her window at the Arlington skyline. Lights stretching into the distance. Millions of people living their lives. And somewhere out there, in hospitals and clinics and military bases, people were suffering because the system protected the wrong people. But that was changing. One investigation at a time. One corrupt surgeon at a time. One broken system at a time. Emma thought about Marcus Hyland sitting in federal prison, about his 18-year sentence, about how his name was now synonymous with medical abuse. She thought about the nurses and residents who'd found their voices, about Jennifer Walsh starting fresh at Johns Hopkins, about Sarah thriving at Mercy Ridge without fear. She thought about the captain from Fort Campbell, about Lieutenant Kim from Fort Benning, about all the people who'd reached out because Emma had shown them that speaking up was possible. The work wasn't finished. It would never be finished. There would always be another Hyland, another corrupt system, another fight. But Emma was ready. She'd spent her entire career in emergency medicine learning that you couldn't save everyone. That sometimes you lost patients despite your best efforts. That the only thing you could control was whether you tried. This was the same, just on a larger scale. She couldn't fix every broken hospital, couldn't stop every abusive surgeon, couldn't prevent every injustice. But she could try, and trying mattered. Emma stood and walked to her bedroom. On the wall was her medical degree, her Army commission, her combat deployment ribbons, physical proof of everything she'd survived and accomplished. But the thing she was most proud of wasn't hanging on any wall. It was the knowledge that she'd stood up when it would have been easier to stay silent, that she'd fought when the odds were against her, that she'd refused to let power protect people who didn't deserve protection. That was the legacy that mattered, not the medals, not the promotions, not the news coverage, just the simple act of refusing to accept that this is just how things are. Emma changed into workout clothes and went for a run, 4 miles through Arlington at 2 a.m. The streets were empty, just her and the pavement and the rhythm of her breathing. When she got back to her apartment, she felt centered, clear. She showered and went to bed. Her last thought before sleep was about tomorrow, about Fort Hood, about Fort Benning, about all the work waiting for her. She slept dreamlessly and woke at 0600 ready. The weeks that followed were intense. Emma led investigations at Fort Hood and Fort Benning simultaneously. Both cases resulted in suspensions and federal charges. Both hospitals implemented new oversight protocols. Lieutenant Kim sent her a message after the Fort Benning investigation concluded. "You saved lives here, real lives. The surgeon you took down had a history of complications that got covered up. We found evidence of at least 4 preventable deaths. Because of you, that stops now. Thank you for listening when nobody else would." Emma saved that message. Read it whenever the work felt overwhelming. 6 months into her new position, she gave a keynote speech at the Army Medical Department Conference. 2,000 medical professionals in the audience. "I'm not here to tell you that I'm special," she began. "I'm here to tell you that I'm ordinary. I'm a soldier who did her job. The only difference between me and the hundreds of people who stayed silent is that I refused to accept that staying silent was an option." She paused, looking out at the faces watching her. "Every single person in this room has power. You have the power to speak up when you see something wrong, to report abuse, to protect patients, to demand accountability. The system only works if we make it work, and we make it work by refusing to let fear silence us." The applause started slowly, then built into something thunderous. Afterward, dozens of people approached her, some with complaints about their hospitals, some with stories of abuse they'd witnessed, some just wanting to shake her hand. A colonel pulled her aside. "Major Cortez, I was at Landstuhl Medical Center when you were deployed. You operated on my squad leader after an IED strike. Saved his life. He went home to his wife and kids because of you." Emma remembered that surgery, remembered the blood and chaos, remembered fighting to keep a soldier alive while mortars fell outside. "How is he?" "Good. Great, actually. 2 kids. Working as a teacher now. living his life because you gave him a second chance. Emma felt emotion tighten her throat. That's good to hear. I just wanted you to know you've been saving lives longer than most people realize. What you did at Mercy Ridge was just the world finally paying attention. That night, Emma sat in her hotel room and wrote an email. To Sarah, to Jennifer Walsh, to Lieutenant Kim, to every person who'd come forward, who'd testified, who'd risked everything to tell the truth. I wanted to say thank you for your courage, for your testimony, for refusing to stay silent even when silence would have been easier. We changed something together. Systems that protected abusers for decades are being dismantled. People who thought they were untouchable are facing consequences. And it happened because you stood up. I know it cost you something. I know it wasn't easy. I know some of you lost jobs, relationships, peace of mind. I know the price was high, but I want you to know it mattered. Every word you spoke mattered. Every document you provided mattered. Every moment of courage mattered. We did this. All of us. Together. Thank you. She hit send and closed her laptop. 1 year after Hyland's conviction, Emma stood in front of Mercy Ridge Medical Center for the last time. The hospital had been completely restructured. New leadership, new policies, new culture. The place where she'd been assaulted and suspended was now a model for how civilian-military medical partnerships should operate. A bronze plaque had been installed near the main entrance, in recognition of the courage of medical professionals who speak truth to power and demand accountability. May their example inspire us to always put patient safety above institutional protection. Dedicated in honor of Captain Emma Cortez, USA, whose refusal to stay silent changed this institution forever. Emma stared at the plaque for a long time. She hadn't asked for this, didn't want her name on anything. But maybe it mattered. Maybe the next person who walked through those doors and saw that plaque would find the courage to speak up about something wrong. Maybe that was worth it. Sarah appeared beside her. Pretty cool, huh? I don't need a plaque. I know, but we needed to put it there, for us, so we remember that speaking up is possible. Sarah smiled. Also, the new chief of surgery, she's amazing. Actually listens, actually cares. It's like working at a completely different hospital. That's good. It's more than good. It's what you made possible. Emma looked at the young nurse who'd been one of the first to stand up, who'd offered to testify before anyone knew how the case would end. You were brave before I was, Sarah. Don't forget that. We were brave together. They stood in front of Mercy Ridge for another moment, then walked to the parking lot together. What's next for you? Sarah asked. Fort Lewis, another investigation, then Fort Campbell, then probably 3 more after that. You ever get tired? Emma thought about that. Sometimes. But then I remember why I'm doing this and I keep going. What's the why? Emma looked back at the hospital, at the plaque, at the building where everything had changed. Because I was scared once, scared to speak up, scared of what would happen if I challenged someone powerful. And I did it anyway. And it worked. And now every time I help someone else do the same thing, it proves that fear doesn't have to win. Sarah hugged her. You're going to change the world, Emma Cortez. I'm just going to do my job. Sometimes that's the same thing. Emma drove away from Mercy Ridge and didn't look back. The highway stretched ahead. Miles of possibility. Work waiting. People who needed help. Systems that needed fixing. Her phone buzzed with a new complaint. Fort Bragg this time. Emma pulled over to read it. Anesthesiologist with a pattern of negligence. Staff too scared to report. Patient suffering. Emma made the calls, set up the investigation, scheduled her travel. Then she merged back onto the highway and kept driving. The sun was setting over Phoenix, orange and pink spreading across the desert sky, beautiful and temporary and perfect. Emma thought about Marcus Hyland in federal prison, about power being something you earned instead of something you owned, about how the mighty fall when someone refuses to accept their authority. She thought about all the people she'd helped, all the investigations she'd launched, all the corrupt systems she'd dismantled. But mostly she thought about the next person who was sitting somewhere right now, scared and alone, dealing with their own version of what she'd faced. That person needed to know that speaking up was possible, that fighting back was possible, that winning was possible. Emma had proved it, and she'd keep proving it, one investigation at a time, one corrupt surgeon at a time, one broken system at a time. The work was never finished, but that was okay. Because Emma Cortez wasn't the kind of person who walked away from unfinished work. She was the kind of person who walked straight into it, eyes open, ready for whatever came next. The highway stretched ahead into the darkness, and Emma drove forward without hesitation. Because that's what you did when you refused to stay silent. You kept moving, kept fighting, kept proving that power wasn't something the powerful owned forever. It was something that could be taken away when they abused it, and Emma had become very good at taking it away. She smiled and accelerated into the night, already thinking about Fort Bragg, already planning her next move, already preparing to stand up for the next person who needed someone in their corner. The fight wasn't over. It was just beginning, and Emma Cortez was ready.